abbiamo tutte le penso che oggi la prima mi tocca o bahun ne non c'è perché la te tanto dato un calcio perché la c'è due giorni la fiata ti vai che la no ti ospai la te tutto che na ti c'è un po' toccata che dato un calcio che non c'è che poi anche un Capite per che poi è aperto che uscì che non pochi a
We have a few that need to be called in and wanted to be excused today. A few that need to be are going to be late. Looks like Charles is going to be late, but he walked in. So Kathleen called in. She's sick today. Bill had an appointment. Charles came. Lisa's going to be late, and Sheridan will be late. Is anybody else that needs to?
Mine needs to dip out about 1 o'clock.
1 o'clock. Move for approved excuses.
I need to leave at 3:30.
Motion to approve excuses, second by Martha. Any questions? Stan, all in favor of approving excuses?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12.
Opposed?
0.
Not voting.
1.
Motion carried. Did Mr. Kindle need to be excused today too?
Yeah.
I think he has some stuff going on today, some personal stuff, so we can add him to the list for excuses. Today we have on the agenda, we were on our regular agenda yesterday. We got to as far as communities. We did a few resolutions, and today's the day for our guests, the Tribal Health Alliance, to come in and talk about the compacting of the IHS. So they sent down Chris Walker and Elliot, last name again? Neil Holland. Come down and do a presentation today. We wanted it on Channel 93, plus we invite anybody that wants to come in from the public to come in and listen to the presentation today. So if you can make it in, that'd be really a good thing for you guys to be here today to think back to your communities what we're trying to do with the IHS, so to improve our health care. I'll call on Chris Walker. He can introduce himself, and he can introduce Elliot again.
Mr. Chair, can I have him here?
Yep.
Is that microphone here?
Yeah.
Yep. Elliot, you want to come up too, please?
Do you want me to drive?
Maybe so, yeah. Okay. So we need to spend most of our time here, right?
Right. There's a microphone there. We got Channel 93 for the public, so.
Is it just going to be
Yes, sir.
I just got from the deal too that there's only microphones that are working, so just for the public's information, if you can
the slides from there?
Do what?
Can we advance the slides from there when we get
I
there?
don't know if we have a remote or not to do that. We should be able to, you
Yeah.
would think.
Yeah.
Samantha,
Okay.
Sam, is that on? Is that on? Is that channel 93, can they see that?
No, I'm gonna move the camera.
Okay.
Chris, can you, after you introduce yourself, can you start talking about the history, how far back we go as far as starting this process and how we got it started, and then you can kind of lead into the Tribal Health Alliance work groups and that kind of stuff.
Okay.
Okay?
Yeah.
Thank you.
Well, good morning, all. I'm Chris Walker. I'm the CEO of Tribal Health Alliance, actually the founder of this organization, and it's a consulting practice that works with tribes in various capacities in improving their healthcare delivery if they're already operating the healthcare systems. And then we also work in the space of going through the feasibility process and working with legal counsel to assume operations away from the Indian Health Service and actually developing that into a tribal healthcare system. My background is I've been involved in this work since 1997 when I joined my tribe, the Cherokee Nation of Oklahoma, and ultimately became the executive director of our healthcare delivery system back in Oklahoma for several years. Then I joined the Bush administration briefly as the senior advisor under Secretary Thompson and Leavitt, and working with Dr. Grimm. Some of you who've been around a while may remember when he was the director of the Indian Health Service. And then I returned back to Oklahoma in 2007 and started Tribal Health Alliance. So we've been working with tribes since that time, and I'll have Elliot come over here and introduce himself. We have a PowerPoint presentation that we're going to work through today, and it is actually an updating, it's an educational tool to kind of apprise you of where we've been. And as you'll see, it says it's May 17th was the original time that we came before this body here and went through this, and then we'll have the updates, progress updates of what's occurred since May to now.
Good morning, everybody. Can you all hear me okay? My name is Elliot Milholland. I'm with the law firm of Hobbs, Strauss, Diener, and Walker. We are outside counsel to the Rosebud Sioux tribe. And our law firm is a firm that was started over 45 years ago. It's dedicated entirely to serving tribal nations and advancing tribal issues. Tribes and tribal organizations are our only clients. I am based out of our Washington, D.C. office. We have offices in Oklahoma, in Portland, Oregon, and in California. Our attorneys were instrumental in the development of the Indian Self-Determination Act back in the 70s. Those attorneys are no longer with us, but we carry forward their work and legacy today. We work with tribes across the country in various stages of this process, from tribes that have are just Title I, tribes that are thinking about our direct service, and tribes that have moved on to Title V compacting. So we're very familiar with the process, and we're here to assist in the negotiations with the Indian Health Service.
Again, it's an honor to be here with you today and to discuss where we've come to. And Elliot and I are going to be moving back and forth from the mic and advancing through this PowerPoint screen for you. But I did want to start by providing just a little bit of historic information. And this actually involves what the tribe has been moving forward regarding the various things of looking at the need and concerns of the existing Indian Health Service and where it is today. And this is predates our involvement with the tribe, but there's been various studies and community needs assessment, community readiness assessments that were completed under various grants in the past, going back to about, I believe, 2014, 2015, and these came to the concern of the tribe at a very difficult time for several service units in the Great Plains area, when CMS was coming in and doing evaluations and pretty much ordering the agency, you need to shut down your ER. You need to quit admitting patients because there's issues in documentation findings and things like that. And, tribes have, the organizations have addressed those concerns of the CMS, and they've been able to improve that. One of these was the Winnebago tribe, that during this time frame elected to go down the process to assume the operations of the Winnebago Hospital. And they actually assumed a hospital that wasn't able to bill for their inpatient services. So it was still sanctioned, I guess would be a good term to use, and not able to bill for services rendered on an inpatient side to CMS, which would be your Medicare and Medicaid, but not your private insurance. And this did affect your hospital here at Rosebud, when a lot of deferrals were occurring within the emergency room, and where patients did not have a good continuity of service and with the facility, and were being deferred out to other healthcare facilities in the private sector, which that hits the PRC funds, or at that time the contract health service funds. So, and then there have been previous tribal councils have passed various resolutions and to approve 2 letters of intent, which that's just a formal letter that is sent to the Indian Health Service, that just informs the Indian Health Service we as a tribe are looking into the possibility of going through the study process to look at assuming the operations. There's not a date specific to that. It's just that you're seriously looking at how's the facility operated today, what are the resources within that, and as we come about that process to eventually determine, do we want to assume or not, and how do we want to assume that, and what parts of it do we want to assume. All those things are kind of open processes. So, okay. So we're open to any questions at any time, okay?
What day was, excuse me, what day was the letter of intent?
Do you recall?
There was, when Mr. Bordo was the president, the council had made a motion to send a letter of intent to possibly contact the hospital. That started the process. And when I came into office 2 years ago, they sent another letter up reaffirming the letter of intent to contact the hospital. So it's probably been within the last 3 years.
We have that as a historic document, and I believe it was in early 2021.
I think that was the, when it was reaffirmed,
Reaffirm, okay.
because I wasn't on council when the first letter did, and that was in the late 20s.
As I alluded to, this is an education process today, and we're going to go through these slides, and where we're at now is discussing about what are the steps of the negotiation process, and Elliot and I will be discussing these. And so where we are right now, and being involved with the Rosebud Sioux tribe, Starting in about 2022, we've provided 2 self-governance training sessions with leadership of the tribe, council members, to educate them about these steps. And so if this is something you feel we need to come back in again, because this isn't, we're not going in depth here. This is just kind of the top side of these processes. So where we're at today is we're in the planning and what we call pre-negotiation phases of this process. And that's a lot of fact-finding with the Indian Health Service, making information requests, understanding what is the Rosebud Service Unit. So these are formal processes that we go through in making a data request, an information request related to the area office and the operations of the service unit. So yeah, so go ahead. Elliot?
No.
Yep.
Oh.
Yeah, go-
Well, let me just,
Hands coming up.
Hands coming up.
Go ahead,
Oh.
Ayla, and then Emily.
good morning.
I was just getting some messages, I don't know if any other council are, if we have the capability to have people call in and ask questions.
Probably set that up, how we did that before, we said use this phone here, right?
Okay.
We had somebody call and take the message down and then ask the question and we answered it, so.
Yeah.
Yeah, you're welcome to text somebody too, you know, if you have a question, just ask the question for them, that'd work too.
Thank you.
Wait, Chris.
All right, was there another question?
No, wait.
No? Oh, okay.
Emily, did you have a question? No, I'll take
Така, ще чекала една чапи, чом те още не печи за. I just have one question, just going forward. These steps of negotiation process, is this just you guys' plan to how Rosebud's gonna acquire IHS, or what's the whole step process? Also, how many IHSs have you guys done since '97? Or since you guys started? Like, how many tribes have done this process?
The assumption process, we probably work with a dozen tribes that have expanded their service delivery with the Indian Health Service. They may have been doing behavioral health or CHRs, and then they assumed the outpatient services that are in their community. You're unique because you have a hospital as well, and so we work with the Winnebago tribe on their assumption of their hospital system.
Okay. My question is, how many IHSs, how many hospitals throughout the tribes have you guys contacted?
Well, our firm, we've worked with a number of them. We work with hospitals, a number of hospital systems in Alaska that are all under compacted. We work with a number of health systems, Navajo health systems, that have moved over to Title V compacting. We also work with a number of tribes in Oklahoma that have hospital systems that have compacted. We work with the Eastern Band of Cherokee Indians that have compacted. We work with the Mississippi Band of Choctaw Indians who have a hospital who are compacted. And there may be others, but as a firm, we've done a lot of these.
Okay. Then how many of them are like our tribe? Central South Dakota rural community, not the wealthiest tribe out there, like the Cherokee or the nations of Oklahoma or Alaska.
Well, I think that the,
What's your turnover rate, I should ask? Like
Turnover.
success stories.
I think that it's a process. It's a really good question, right? Because you are in a unique area here. There are unique challenges for healthcare delivery systems here. These endeavors are never, it is a significant undertaking to do this. And it's a process. You don't go from 0 to 60 in this process. It's a process over a term of years to get to some of these other health systems you see, like the Alaska Tribal Health System, is one that's taken years to develop into what it is now, where you have regional clinics referring to the regional hospitals and then referring patients to Alaska Native Medical Center. They have a whole integrated system of care called the NUCA system of care there. But it's taken years to develop. And so, but they didn't get there immediately. And neither would any tribe that seeks to do this. It is step-by-step process. And so the planning process is designed to ensure kind of, one, that the actual transition is going to work for the patients, for the employees of the hospital, for the community, so that things stay the same and you're still getting the same level of care, and then have a path forward to improve care to where it needs to be. So it's a big process. It's not a, these are good questions to ask.
And those are very good questions to ask. And in response to the success rate, none of our clients have ever moved to retrocede back to the Indian Health Service. They've continued to grow their health system. And we're not legal counsel, which takes you through the legal process to assume operations. Our firm has come alongside other tribal healthcare delivery systems when they kind of find themselves at a crossroad and they realize, hey, we need some technical assistance to continue to improve our healthcare delivery system. And so that's where our company comes in with our expertise around the business office for your billing and coding, looking at your mental health services, looking at your nursing and physician services, and how we can assist and promote and continue to grow those operations. But that's a very wise question to ask about, those tribes that have taken on this responsibility, and then down the road, it's like, we're done. That's always your right. But we've never been down that path.
That's, I would say, the same for us. I mean, the tribes we've worked with have been able to increase healthcare delivery to their communities. Again, it's not instantaneous. It doesn't happen the day you take over, but it's a process of growth over years.
And retrocede is, to clarify.
To retrocede a program, that is when you voluntarily give a program back to the Indian Health Service.
So if it doesn't work.
If it doesn't work,
you have a safety net.
you do.
Give it back to the
The IHS is always on the hook. The IHS is always on the hook.
because it's their trust responsibility.
It is.
That's right.
And treaty responsibility.
And assist us to make sure it goes through,
That's right.
That's right.
if we wish.
Exactly.
Yeah. But what we
So-
okay. Go
Well,
ahead.
maybe just to talk a little bit about these 4 steps quickly. The planning stage, again, and we're gonna talk about each one of these steps in more detail, but these are the 4 main steps in any assumption. First is the planning and the pre-negotiation stage, and that's where we are now. Gathering information, creating the legal structures to be able to successfully operate the program. Then there'll be a negotiation period, and we're not there yet. That's when there's a formal, proposal submitted to the IHS, and then post-negotiations in terms of, standing up the entity and operating it. If you want to go to the,
Yes.
I can't.
Why don't you have your hand up? Go ahead.
They asked why the Great Plains area office tribal shares funding are still using 1980s data to determine our shares. Obviously, our population and needs have grown over 43 years.
Do you want to take that one?
No, you can take
Okay,
that.
I'm going to take that one. Thanks.
Technical.
Well, this is, so the determination of tribal shares. That's a very good question, right? And I sympathize with the person who's asking that question, because they're right. Populations change and grow, relative to one another. What the IHS's position, this is not my position, this is the IHS's position, is that the tribes, and this is what they will tell us in negotiations, that the tribes got together and there was a process back in the 80s when those tribal shares were determined, and it may be that the tribes were not involved, that IHS just did it unilaterally. I don't know. That's information that we're still trying to gather, exactly how those shares were determined. And there was basically a formula where they were dividing up and assigning the tribal shares associated for each tribe in the Great Plains area at that time period. Once tribes started taking programs, right, and a lot of the tribes in this area have under Title I, they've taken CHR or EMS or behavioral health, these different programs. The tribes then have a right to take their portion that IHS has allocated to them of the tribal shares, right, of the area shares from the area office. And that's a percentage. And I don't know off the top of my head, because we're still gathering the information, what Rosebud's percentage is vis-a-vis the whole area. But the IHS, and this is not just in this area, but across the country, they take the position that those shares determinations were made back then, and if we were to try to redetermine them, one tribe cannot unilaterally do that. All the tribes would have to get together and agree. And so it's difficult then to renegotiate those, because the IHS basically takes the position that those shares are set, and we'd have to have everybody come together to redetermine that. Again, that's the IHS's position. And that's why that's the case.
And you say all tribes, is that in the state or state?
No, in the Great Plains area. Right.
Thank you.
Because the reality is tribal shares translate into operational dollars to develop your health care. And if your population has continued to grow, the other side of that is appropriations have grown, and there are some processes of funding with the Indian Health Service that do look at those unique issues like population growth. There's the Indian Healthcare Improvement Fund that started 20-some years ago that really looks at those tribes that have a lower resources of the Indian Health Service funding versus other areas. I mean, you would arbitrarily think healthcare to a Native American, you get $1,000 per capita for inpatient services across the United States, wherever you live as an Indian. That is not true. There's so many pieces in these formulas that even by area, some areas get penalized because there's better access to care because you have a hospital 10 minutes down the road. But just because you have a private hospital doesn't mean a Native American has access to care. That's what we dealt with in Oklahoma. The 12 area offices, Bemidji and Oklahoma are the two at the bottom when it comes to certain things. So you got to get creative. You got to start looking at how do we get that third party done, and how do we work. And that's tribes taking that responsibility. And the Indian Health Service will do it, but they're pretty handicapped on how they can work with the private sector health system to bring health care to them and vice versa. That's an excellent question. And that's why I'm always an advocate for the Indian Healthcare Improvement Fund, because I ran an operation that was 24% funded when the IHS would say, well, we're 50% funded. Well, Cherokees aren't.
Well, one point to add to this is that, and this is slightly different from what the person was asking the question, but with increased population, right, increased population growth, that means more patients, and that means more people to provide care for. The IHS funds, as we know, IHS funding has increased over, for everybody over the past few years. We're still not to mandatory funding. We're still advocating for that in Washington, D.C. But the big game changer that's really made a difference in terms of healthcare delivery for tribes in recent years is Medicaid expansion. And so if you have more patients, you'll be able to generate a lot more revenue from Medicaid expansion. And that's really been an anchor in South Dakota, right, for access to care. compared to tribes across the country. You know, in Arizona, for example, the purchase referred care, you know, used to be called, you know, contract health service. They used to be priority level 1 only, life or limb, across the state. Now they're, I think, priority 4, right? So, because of Medicaid expansion. And they're thinking about expanding the PRCDA to the entire state to reach the communities who are not just located on the reservation, because there's enough funding now to do that. So we may, that's an opportunity now in South Dakota that didn't exist before. And there's a, you know, we're on the precipice of getting a lot more funding in for Indian Health because of that.
And that's a recent decision that your state made. It started in July 1st was the
Chris, we have
Medicaid.
a tribal member that wants to ask a question.
Oh.
Go ahead, Phil.
Good morning, my name is Phil Sweigel. I'm the Executive Director of the Treaty Council. When we talk about tribal shares, what is that compared to? Is that across IHS? And then also, what are the dollars per capita compared to the prison system that they received? At one time, I heard that the prisoners got more funding for health care than we did at IHS.
Thank you. Those are two very good questions. I'll take the first one, maybe just to kind of talk about what we're talking about tribal shares. And this is in the negotiation phase, right? So later on in the process. But tribes, when they take over a program, and you have the right to, actually you've done that with your Title I programs already. You can take what are called your program, your service unit level shares, the ones that are actually here in the service unit, in the Rosebud service unit. And that's the majority of the funding, right, is at the service unit. Then the area office, because the area office provides services for you. You have the right to take, and those are called, and headquarters, those combined are called tribal shares. And so you can take area office shares and headquarters shares, the money that the area office was spending on programs to benefit Rosebud. You can take that funding and then use it here in your community the way you think is best. So that's what we're talking about with those tribal shares, and those are determined based on the existing line items and budgets of the area office. And then there's a smaller portion yet too from headquarters. So if headquarters is running some programs that really aren't benefiting anybody in this area, you can take over those programs, right? And a lot of tribes have, right? There's educational programs down in New Mexico, for example, where, you know, folks here don't really have access to. So tribes will take those headquarters shares to use them here in the community. And by shares, that translates to dollars, right? And so that's more dollars. To your point about the IHS funding being abysmal and wholly inadequate, it has been, the Indian health system has been underfunded for 150 years, right? Since those treaty promises were made, they were immediately broken. And you're correct. There's data that the per capita spending with IHS dollars is lower than Medicare, it's lower than private insurance, it's lower than Medicaid, it's lower than what the feds pay for prisoners. And that remains the case. Now, IHS funding has been increasing in years, and there's a big push nationally for tribes to make it mandatory funding, which is an increase of about $50 billion, but that hasn't happened yet. But that's a good point. I mean, the IHS has been dramatically and drastically underfunded compared to the rest of the country.
Jordan.
Thank you. Thank you guys for coming. I got a couple questions for somebody. So, what happens if the yearly allotted money is spent early? Like we would get, right? So they're asking how, if it's spent within 6 months, then how would we go the rest of the 6 months without the funding?
Well, that's a budget operations dilemma, and that is part of our fact-finding with the Rosebud Service Unit, is to look at their budgets and to see so you're typically whether you're tribal operated or IHS operated, you're utilizing the federal dollars first, and then your third-party dollars would be second. And what is unique that you, as an organization and as leadership, need to understand here is because of the closure of your emergency room several years ago, there is it's called an accreditation fund. And we've recently learned that the headquarters appropriation, so this is not an area appropriation, this is a headquarters allocation directly to the Rosebud Service Unit, is approximately $13.4 million a year. That resource will continue to be a funded allocation to the new organization as well. And of course, as you realize, the Indian Health Service is in a contractual relationship to keep that open. And that's a very expensive process, and it would certainly be, the hope, as an assumption occurred, that you'd be converting contracts into emergency room providers that would be employees of the health system, that would reduce that amount, but it's not going to reduce the funding you receive from the Indian Health Service. So yeah, we don't see in what we've examined that the Rosebud Service Unit has been an insolvent organization. They've been able to meet their budget, and honestly, at some level, that would probably be what we would call salary savings, because they haven't been able to staff, but they have the budget and resources, and thus that stays kind of on the books.
Okay. And then the next question they're asking is, who's qualified to run the hospital? I don't know if you can answer that, or is there an answer?
Right now, like I told you a few meetings ago, that the council did approve their charter, so they have a board of directors, I would guess you would call it, of qualified people on that board, and they actually have a CEO. His name is Scott Miller, that's come in to help us set the process up. So he's kind of like our CEO at this point for Sioux Oyate Healthcare. So highly qualified person. So.
Okay. And then you guys kind of already touched on it, but they asked what happens when the tribe fails. Is the government obligated to take it back, or did the tribe just give them the means to walk away from the treaty rights?
I can take that one because it's a legal question. No, the United States is always on the hook. So if, things go, and we don't think they will, but if things don't go as planned, the United States is obligated to reassume the operation.
Thank you.
You want to go through some more steps?
Lila has a question.
Yeah.
Want to get started, but the calls are coming, calls are coming in.
more important.
Yeah.
That's what people need to know.
Yes, exactly. Thank you, I appreciate that. Okay, so this is in regards to, where am I? Okay, if they cannot, there's patients up there waiting to be transferred. If that can't happen, and our ambulance service is like, staff shortage. They don't have enough money to hire more people and all that. They can't do a transport. And these people end up staying here at the hospital till they can fly them out, whether, whatever the issue is. And then they lose the bed while they're waiting. And it says that's one issue. And it takes 5 to 6 nurses per shift to manage people. It costs a lot of money, and it's hard to get because the labor rules for the nurses are different. a ER and inpatient has to have CMS, and I brought this up, Joint Commission certification. If this is lost, we can't bill for services, and they'll have to close down the ER and the inpatient. And the fear, these are the fears of what could possibly happen, the scenario. And of course, our people, we're gonna come at you with all the ugly stuff, because we live it every day. We've gone through it. We had the diversion happen here. So that fear has escalated a whole lot even to today. We still have not really resolved some of that stuff, like the ambulance service, we ran them to the ground. So these are fears that people have. You know, all of it is legitimate, it's real, it's happening now. IHS can do so much, but the flyouts, you know, that's a big concern for people. Thank you. Oh, excuse me again, Mr. Chairman, can we ask to have a few more chairs in here in case people come in? We should have chairs here for people.
I asked them, they're aware, they just
Okay.
had to let them know.
Okay, thank you.
Thank you. Hopefully you can hear me. I have a couple questions, but I'll just start with one. Can you explain a little bit about the process of who selected the new board and the CEO?
Yes, so the charter, which was approved by council, sets up a board to run the Sichangu Oyate health system of 9 individuals, 5 of whom are required to have a healthcare background or public health or a medical degree of some sort. 2 of whom are ex officios, meaning the first is the president of the tribe, and the second is the head of the health committee from council. And then there are 2 others on the council. And the way the charter is determined, the way the charter is set up is that the council selects the board. They make the initial selection for the board. Then thereafter, the board selects new members when their terms expire. So the council selected the first round of board members.
And then to address the appointment, is what I would say, of the interim CEO. That is a gentleman that came from our firm that is filling in that role simply on an interim basis to start several of the processes and activities that are needed as you stand up a healthcare delivery system. And is the council aware of who the board members are? I know those who were at our work session recently learned who they are. And I would say we as consultants and legal that weren't involved in that. We know many of these people, and but that wasn't something we were tasked with assisting and finding on behalf of the board. But the Dr. Don Warren holds 2 positions. He's a family practice physician, Native American, and he's the director of the School of Public Health at North Dakota in that medical school, and he's also a co-director of the Johns Hopkins Indigenous Center as a recent position that he accepted. Then there's Allison Kelliher. She is also a Native American, Alaska native. Prior to earning her medical degree, she was a traditional healer in her communities in Alaska. Both of these individuals, Don and Allison, very integrated in a lot of the high-level public policy issues occurring in Indian country. related to improving recognition of healthcare delivery in Indian country. And one of these dynamics they're working on is graduate medical education dollars coming to a tribal healthcare delivery system, like in a hospital. So it'd be supporting residents coming, and you have had residents coming through Mass General and the relationship, Dr. Matt Toby, and as this moves forward, that would continue. And I know there was a question that we received yesterday, and one was about recruiting physicians, and in some of our teams and discussions, Dr. Toby has attested to the fact that Mass General Hospital has had several residents who had a strong interest in serving in Indian country and in a very rural setting, remote. I mean, that defines you 100%. It was the inability and the length of time it would take IHS to secure these people. You know, some of these people have debt, and so I don't know if IHS ever secured a resident, but they were certainly here and they were certainly willing. Under a tribal operated system, that's not going to be the issue moving forward. We didn't address your issue about these transports and things like that. That's alarming, that those kind of your community has to face those type of situations. And again, that's, I don't mean to, IHS has this responsibility to take care of a patient, and the transfer of a patient is certainly a medical decision, and I don't know why they're not being effective to find some location for them. Unfortunately, if it's not Rapid City or Sioux Falls, then you might be going further away, which is only creating another level of handicap for family members in dealing with a member that has to be so far away. And we know, like dealing with Alaska, there's a lot. Think of an Alaska Native Health System. It's a tremendous healthcare delivery system, but they have those issues where they're having to transport people to Seattle for care, for real specialty care, like a brain injury or something like that. And so it's, you want those relationships where it's the best place for a patient to go for some of those really unique specialty services. And unfortunately, the last thing you want to do is put someone on a fixed wing or a helicopter, because now you're talking about a huge expense.
Yeah, Wayne, go ahead.
How many slides do you have for your presentation?
13.
Mr. Chair, could we go through this presentation and then ask the questions afterwards? Sure. So that we kind of get an overview of what's going on.
They're all good questions, and I had them in the back of my office earlier, and we talked about some of the issues that were coming up as far as the questions that would be asked, so they know there's going to be some hard questions asked, so they're prepared. So,
And our slide may answer some of those. I appreciate that. Because as we get into this, the way this was set up, this is just basic needed information and education. And as we get into some next slides, then it's kind of showing since we were here last time, and unbeknownst to us, we did this presentation, and it was that same day that the Tribal Council approved the charter of the organization. That happened on May 17th of 2023. So what we have done is, going through this, is really what has occurred since May 17th to today. Okay.
Why don't you start with work groups?
So,
Well, there's two of us here, but there's a whole team.
there's a whole, yes, there's two of us here, but there's a whole team. And the way Hobbs Strauss is a legal firm and Tribal Health Alliance, this is a very intentional process of developing teams. So you'll see there's a steering committee, and that's made up of certain members. There's an HR team, there's a finance team, a business office team, purchase and referred care, procurement and contracting, patient services, support services, which is going to be housekeeping, IT. Then you have attorneys and consultants. And then we're going to have, at some future point, when the process is, now's the time to start negotiations, then there'll be a selected group that are your negotiators, like your warriors, going to the table, okay? And then there's the whole thing about public relations, which would be, and what we've heard is that there's been some level of a lack of community discussion about this, and so that would be, developing a radio ad or going to a community to really talk about these processes. So these are the various teams, and these are made up of individuals. Each has a lead. Each of these has a task list, because these are very process-focused tasks that need to be completed to build the capacity of the health system, Rosebud, Sioux, and the health system to take on the operations. So it's a lot of fact-finding. So these are individuals that are consultants on our team and employees within the tribe. So your finance department, your procurement department, IT department, all these people are looking at all these tasks and situations. And this is a real short list, but I don't know how many information requests, that's a term we use of when we send a letter to the Indian Health Service. But these are some of the areas, the information that's been requested, such as the big one is the tribal shares. What's the money? The service unit, and looking at the operating budgets and financial reports for the past 3 years. So we want to look at trends. What's been a good year? What's not so been a good year? Looking at your third party. Well, come July 1, we know this third party is going to be a game changer, because the state expanded Medicaid, and a lot of your members and the services rendered are going to increase that third party. On that third bullet point about operating budgets, across the Indian Health Service, there's a budget book for each service unit, and they don't like to release those things sometimes. So we're making those requests so we know how is radiology funded? How is this department funded? Because you get federal resources and you get third party. You get 3 types of third party, and what third party dollars are paying for goods and services, paying for personnel. Because, they've had to figure out how to operate the facility, and we're not going to question that. We want to look at it, is that a best practice? And start budgeting the same way until improvements can be made around some things. And one would be converting contracts into employee contracts into a position. Looking at the facility user data, who are the beneficiaries over the last 3 years? And we've already identified there's quite a discrepancy between what IHS is going to call, this is our user population, and we get resources to take care of this population. And then when we talk to your enrollment department and we learn how many Rosebud members are that live on or near the reservation, well, it's like twice the amount of the user population. So, yeah. And what is the third-party revenue? Looking at the PRC data, who's being sent out? I won't get, that's a big headache sometimes. And then looking at their organizational chart and the vacancies. So, because if there's a vacancy today, then that's going to become an organizational employee, not an IHS employee, unless IHS staffs the position between now and should the assumption occur sometime in the future. And I guess it's important to know that last spring, President Herman issued a letter to the area director because this happens at every assumption thing. What's going to happen to our jobs? In fact, one of the questions to us yesterday was, does this mean all the IHS employees are fired? No, not at all. In fact, the commitment from the tribe is every person eligible for an IPA or an MAU will be allowed to come over. Well, so I use who's eligible. Well, if an IHS employee is on a performance plan, they'll know I'm not eligible for an IPA. But if it's a community member that's doing well, then they could come over. We would want them to come over as now an employee of the organization. So another whole piece that we're doing here is salary reviews and going into the private sector to really look at what would be a salary structure, because you're going to have to offer a benefit package there. Go ahead.
Just one point on that piece, because I think is an important one for everybody to understand. What an IPA is and what an MOU is. So an IPA is an intergovernmental personnel agreement. And that's an agreement for public health service, folks working at the IHS. An MOU is for the Commission Corps. And these are 2-year agreements that can be extended indefinitely. So the offer is, or the pledge was that any employee, and under those systems, they remain federal employees. So they keep all their benefits, all the benefits they've accrued, all their pensions, everything remains the same. They get paid by the IHS, right? So they get paid by the federal government. That stays the same. They're in the same job. They're just working for the tribal system now. And so that was an offer, again, that President Herman issued to the IHS. There'll be a lot more communication with the employees at the facility. We're not at that stage yet, but obviously want to do that, to understand what that is. We're also developing the team is developing the tribal hire option. And that may be something that may be more advantageous to somebody. They may want to look at the benefits package that the tribe comes up with and move over to be a tribal hire instead of an IHS employee. That happens sometimes when people are at the point where they can retire. Mm-hmm. They'll retire and then be a tribal hire, right? Or maybe they're at the beginning of their career, and so the benefits haven't accrued, they're not as concerned about that, and the tribal package looks better. But it's their choice. So, but that's the pledge, and we're still in the process of developing that, so we don't have anything to share there yet, but I just wanted to point that out.
Yeah, thank you. But there's various program reports that we're accessing, and then something, you made a comment about CMS and accreditation, the Joint Commission. It is a Joint Commission accredited facility. We are requesting what were findings in their last survey. We've not received full data around that because we want to be of particular attention to where are those low-hanging fruit opportunities. We have a senior nurse consultant on our team, Elaine Alexander, who when she was with the IHS would go to service units and help them prepare for Joint Commission or AAAHC. So it's beneficial to know where were the findings. I do believe we had very high-level information that they may have had maybe 24, 30 findings, but nothing in the critical state. So I don't know what it's been in the past. This comes about every 3 years, and they had a review this past spring, I believe. Yeah. So they did well on it. Okay. Oh my goodness.
So we already gotten into some of this.
Yeah, so I'm sorry, the font is, apologize for this. So in the planning process, since May, when the charter was approved, so in the management structure, a board has been placed, an executive leadership team has been approved. Go ahead.
Yeah, there's another piece that I think bears explaining as well, how the charter operates. The charter is organized as an independent arm and instrumentality of the Rosebud Sioux tribe. So it retains all of the rights and privileges of the tribe, operates independently, and it's been delegated authority to operate both the existing health programs that the tribe administers, the Title I programs, they're called enterprises in the charter, as well as any new programs, such as a contract or a compact to take over the hospital, the entire service unit. And that would be a separate enterprise under separate leadership by the board. The board's charter gives it independent authority to set procurement policies, personnel policies, which are required in order to operate a hospital. So it has that authority to set all of that, and those are things that the board is looking at right now.
Thank you. So when we look at staffing, the 638 team is already aware of the present vacancies. We have an understanding about the number of open positions they have out there, where the status is of onboarding employees, and that's always going to be a moving target over the next months and months and months. But we keep updating that information. And then, developing the tribal hire option. And we use the term tribal hire, but in reality, it's the organization. Oh, thank you so much. And as Elliot mentioned, we are in that process of developing policies and procedures to assist the operations. Some of those are actually going to be coming before the board as an initial review, a procurement policy, an HR policy, whether it's finalized at that time or if it comes back saying, hey, work on this some more. There's the template of the organizational structure of the system that was created for the board's review. And as Elliot mentioned, so there's these two enterprises. There's the tribal health administration programs and those services, and then there's this arm of an enterprise that's not there yet that would be the inpatient, ER, and outpatient services. Oh, yes.
Before you go to the next slide, so it said on there, present staff positions and personnel will be offered IPAs and MOUs to continue on staff at the SU. So can you kind of explain, I know you did, but kind of explain what the difference is. So if I work there and I do an IPA, does that transfer my retirement and my health care and things like that? And what's the difference between my MOU and the employees doing that?
Okay. Yeah, I can take that just from the legal perspective. The everything stays the same. You remain a federal employee, so you get the same health benefits, the same retirement benefits, pension, all of those benefits remain the same. You actually remain a federal employee, and you continue to get a paycheck from the United States. So none of that changes. What's changed is you're basically assigned through this agreement to go work for the tribal program. And the tribe then pays for that service, pays the IHS back for that service for those employees in something called a buyback agreement. But the employee isn't involved in any of that part. From their perspective, they don't see any difference.
So they don't essentially become a tribal employee, they still stay a government employee.
Exactly, right. And the difference between an IPA and an MOU is the type of employee. So the MOUs are for the commissioned corps officers, and everybody else is under an IPA. But they're functionally the same thing. The agreement's a little bit different, but in terms of the benefits and everything else remains the same.
And I would describe it as it's a relationship. In the agreement, it's the employee, it's the tribal health organization, and it's the Indian Health Service. So there's three parties to this agreement. So the employee's not left out of that agreement, nor is the IHS, because they're still a member of the Commission Corps or the civilian services, but they're now supervised, and they could be supervised by another IPA, but it's under the culture of the healthcare system. So they're not bound by the traditional policies and procedures of the Indian Health Service. And I don't think we...
Chris, we have a question from Chris.
She talked about, you guys just kind of brought up that the people who currently work there now would be able to still be federal employees if the tribe paid back BIA back pay, or what was it called? I mean IHS. Yeah, we'd pay them, so we'd be paying IHS for these people. Would we really do that though? Like all of them? Yeah.
Well, that's something that probably maybe, I hate to call it Marlene, but that's their responsibility to educate their employees on this process, and I think they've been doing that. So they know exactly, all employees up at the IHS should know what IPA means and what MOU means as far as what their options are as far as being a tribal employee or being the same with the federal government. So
yeah, they're pretty aggressive about it too, so they've been talking to the employees. And then once this really gets moving, HR will come in and they will be on site here and they'll work with each employee depending on which route they're gonna go. So they will be here, but they will guide the employees whichever way they decide to go.
So yeah, at some point prior to the assumption, those employees have to make a determination: am I doing the IPA? Am I doing the MOU? Am I requesting a transfer to go somewhere else? That's always a possibility, because for some of them this is a career path issue and you want to honor that. We'd rather keep the intelligence here as opposed to see it go somewhere else, but that is sometimes that's the right of the employee. I might want to do a supervisor job and I might move over to Pine Ridge, or I might move to another area. I might go to area office. We have no idea. But at some point we'll know what is the final net of the number of employees. So now we can see that the, go ahead. Okay. So Resolution 2023-143 was approved on May 17th. That stood up the charter of the health system. The council seated the board, and so as Elliot was addressing, the board has its responsibilities to Rosebud Sioux Tribe, and that is to adopt operating policies, procedures, rules, regulations necessary to conduct the business. So to date, the board met and went through board training. They went through OIG compliance training, so scared the bejeebies out of them on taking on the healthcare responsibility. And that was on August 9th through the 11th. And at that time, they also attended the 638 work group sessions and met some of the team leads, so they understand this whole process, getting them involved. And I'm sorry, we hadn't finished going through all the board members, but we can do that. We only talked about 2. At that meeting, and since that time, the board has held its first inaugural board meeting on September 8th. And they made it through their agenda well. Through that process, they elected officers among themselves. And we're developing a board operations manual for them, so they'll have a work product. This is the responsibility of the board, incorporating these things. They approved the plan to do an independent salary scale development and doing personnel policies. Really, that's the handbook that the health system employees and I would say the IPAs and MOUs as it comes to the conduct of the organization, an independent procurement, HR, and finance policies, and they proved an interim CEO.
Would there be a place we could find the board members, or
Sure can.
where can we find that? Where can we find that?
Oh,
Then it's in the resolution.
actually, the resolution named them. Oh,
I just want to see.
that's there's a different resolution, and I may address that here in a little bit in another slide. I'm sorry. So the charter was established, and then it was this summer, you passed another resolution, I think it was 249, and it actually named the members of the board. So, so it is Don Warren, Allison Kellyar, Daniel Plumage, also a physician. He's with Avera Health, previously worked in the Indian Health Service. There's a gentleman that's a pharmacist. His name is, I've only met these people twice maybe. There's Mr. Bill Snyder, and he is your former South Dakota State Medicaid Director. So,
And then we do have Mr. Warren.
Dr. Warren, yes.
As a board member.
Yeah, actually, and he was elected chair. Yeah. Okay,
Emily has a comment, question. Go ahead, Emily.
Follow up on my question from earlier.
Sure.
So on the board members that you listed, can you tell us more on how that, I didn't hear how that process went, who recommended those people, why are there not more people from Rosebud on there? And also what was the thinking and the thought process for including the IHS contracting with all of our house admin programs? Because I really feel that they are gonna get lost in all this. And that, to me, when I first came in here, I thought there was still a decision to be made on this, and I've been told there's no, we've already made the decision, we want to move forward with compacting. And so I'm just kind of getting that out there for our public so they also are aware of that. And I wasn't aware of these resolutions in the charter. So I'd really like a legal opinion. I don't know if you can give that or if we need to ask Eric on were our processes followed properly? What committees, did a committee discuss this before getting to emergency legislation on the resolution on the council floor? And again, what is the legal, I guess, opinion on having an authoritative body outside of Rosebud oversee all of our tribal programs, like our alcohol treatment, our meth treatment? I mean, there's ambulance, there's so many programs. And I guess the follow-up question were, any of these employees, aside from the director of health admin, consulted in this transition before it was made? Thank you.
As outside counsel to the Rosebud Sioux, I can't speak authoritatively to the internal processes of your, council. So, sure, I understood. With regard to the board, the board is an arm of the tribe. It is like a health department. So it is still the tribe. It's not an independent, it's given independent authority to operate these programs, but it's still functioning as an arm of the tribe. And that may not answer your question. And I apologize if it doesn't, but I'm just trying to provide you as much information as I have to give, so.
I know what Emily's trying to say. She's trying to say who actually selected these positions and where it come from. How did they actually? Yeah. I know the resolution came to. I think maybe Skyla can answer that. Skyla, can you tell us the process of how these board members got selected or how they were recommended to be in these positions? Did it come from the work groups, or how'd that happen?
So how the charter happened was, in the beginning when council instructed health administration to move forward with compacting. So we did all of that, and then so in lieu of all of that, health administration developed the charter, just because of the big old concern was the politics that would get involved with it. So that was developed, the charter was developed, it was approved through the answering committee, which is health board, then it was referred up to council, and then council approved all the resolutions regarding the compacting and the chartering. Then we had these work groups for the compacting, and then at that time the work group selected the people for the charter, and they were contacted, the names were referred to the chartered work group, I would say, and they were selected at that point. And then when we had the meeting in Shakopee, then that's when we had everybody met, everybody met there. Then we had the official first board meeting September 8th, and then Health Administration oversees, as it is, the IHS 638 master contract for the alcohol program, the MRP program, EMS, the detox. So all of those programs are funneled under that master contract. So then under the charter, initially that charter began from Health Administration. So those programs will get funneled under there, and then this compacting is just an umbrella by itself under our charter. I mean, it's not by itself, but it's under the charter as one of them programs that's under the umbrella. So basically those board members. Yeah, everything that happened with the charter and the compacting has gone through answering committee, because that's who I answer to, is to the committee. So then everything got approved by motion, then it was referred up to council. Council did a vote on it, and everything got passed by resolution. And then the charter has a 2/3 vote, if it was to, to get to where you would want to not move forward with it or whatever, but it's in place now, and what he's given a report as far as how far we are into it is where we're at with it.
Thank you.
Okay.
I just have one small follow-up. Does that resolution that created this rescind and change the existing ordinance 9305 that set up the health board? Can you explain the relationship then? Because it was under the health board, those same programs that are now underneath that, or underneath the health board?
I think they still, I'm not sure how that goes. Can you explain that, Skylar? I know we talked about that earlier, about health board still existing, and what kind of programs report to them, because they're reporting to me as far as the ones at the 638 program that are under you. So are you still going to be reporting to the health board?
So as it stands right now, because we had our first board meeting, and I know that the concern about the ordinance for the initial health board at the tribal level, it would they would continue to be in existence, but then they would take care of any programs that were previously under the regular tribal health board. So like, let's say for an example, WIC, they get funded through USDA, but then they report to health board. So this health board at the tribal level will oversee the standalone programs. Then the charter that we're under through the master contract, the alcohol program, and all of us, we are now funneled through the charter. So that's how that works. So if there's any programs that are through the health board, that answer to the health board will continue to see the standalone programs that didn't go under our charter or part of that umbrella, I would per se.
So it would be like,
What, Emily, question?
What are those programs? The standalone that would still be under health board?
So like right now would be WIC, because their funding is through USDA, and it's not part of the master contract. I think for now it's just probably that one right now that comes to the health board, because the majority of the programs are under that master contract, and they're part of that charter, and that was per se a long time goal of the health board programs that I can recall, that it was always the dream of the health programs under the master contract to charter, and so we finally met that goal, to actually charter and move forward you know, under our own charter and whatnot. So it's finally been developed, but, you know, for the most part, I think we follow that whole process, because I did a lot of research to how that all entails, and a lot of work was done into that. And it took about 2 years to get where we're at with that, and so now we're here with it. So now we're on to our second board meeting with that, so.
So my question is, well, first she asked for like so these people are on this board, what are their terms? Like how long are they serving in their capacity? And then the other thing is not really for them. So that board would be much like other chartered entities in the tribe. So the health board is here, and then, or let's say Land and Natural's here, we still hear from TLE, they still report to them
Yep.
monthly, like to give them an overview.
Yeah.
And then we still hear from like BIA or whatever, and so that they get a report, but then it gets referred to like an issue might come up, and where tribal council does the actual talking to this board, right?
Yeah.
So like Redco, actually, they're a chartered entity, they report to Econ Dev, and they're our economic firm that's chartered away. So they give us an update at Econ Dev, but they also, monthly or bi-monthly, but they come to the council, just give an update of how things are working. It would work in the same context, doesn't it? I assume so.
Yeah. That's how it's initially ran. So, like, technically, what we envisioned a charter to be, like, we wouldn't totally just be, like, ignore the tribe.
Yeah.
We would give a report, just like how you would do, like, with Redco.
And the Econ Dev.
Yep. And then so we would give them, you know, like a monthly report, or,
Right.
you know, and also to council, you know, as requested and whatnot. But we would still have some kind of communication with the tribe and with the tribal health board.
You're not just totally autonomous out there.
No.
Oh, okay, so what is the term? 3 years. 3 years per.
It's only be reappointed versus comment, question.
So just to follow up with the IPAs again, so is it 2 years and then it's renewed for the IPAs? And then after that 2 years, do they become a tribal employee? Or
No.
do they continue that government status?
They can continue the government status indefinitely.
Okay,
It's just, the agreements are 2-year periods. They just get renewed every 2 years.
every 2 years,
Yep.
but they still remain.
You could be an IPA for, you know, for years.
Okay, thank you.
Should we go to the next slide, just to get through?
Yes. Okay, so as we shared, we're talking about planning, and that's all the background stuff, and pre-negotiations. That's an activity that's looking at different processes, and one of the processes is, you know, we're kind of looking at getting that bulk of the work done by the first of the year. Not that that's set in stone, but based on what we've accomplished last 6 months or so, 5 months, we feel that's a preliminary target. And but we're continuing to refine information that we're requesting, data, those processes. We've had numerous visits with the Indian Health Service to clarify information. That's just a process we go through. And so that's ongoing. The work groups have been meeting, they come together about every 4 to 6 weeks as a group. Most of that takes place when we come up to Rapid City, but then these groups do have their multiple tasks that they're working on and reporting out. So there's other work that's done during the month. And the process, that third bullet point, is to determine the PSFAs to be contracted or compacted and the associated tribal shares. So, you know, our work and position is that the Rosebud Sioux's desire would be, if they're going to assume anything, they want it to be a full assumption. That means inclusive of the services that they aren't operating today, which would be the inpatient and outpatient services. Outpatient would also include the ER department. And that's the understanding that the board has in accomplishing this task. A part of this whole process is the developing and drafting of the scope of work. And I'll have Elliot discuss a scope of work versus just a direct Title V proposal or something.
Chris, they just handed out a copy of
Oh, perfect.
Title I and Title V too, so if you're getting close to that, you have that.
That's-
to look at.
I don't know who did that, but we appreciate that.
Let me just see where we are here.
Thank you, Mila.
Okay. Yes, so you have in front of you the main differences between Title I and Title V. There are a few others that didn't quite make it in there, but the one of the main things is that the entire hospital system can be taken over either under Title I or Title V. The main difference between the two is Title V gives you a little bit more negotiating authority with the IHS. It also allows you to consolidate and reprogram functions, whereas under Title I, you have the ability, you have the different functions that you've contracted to provide, you have the ability to freely rebudget funding from one program to another. If you want to take some PRC dollars and put them into, direct care nursing, you can do that without the IHS's approval. But if you want to completely change your programs and consolidate programs, you need the IHS's permission. Under Title V, you do not. That's the main difference between the two of them. And so there are certain conditions for participating in Title V. And that's one of the things that we're clarifying with the IHS. We're seeking technical assistance with them. One of the things you have to demonstrate is 3 years of clean audits. And so we are working with the IHS through the audit issues, and hoping to have a final determination coming up soon here as to whether we can proceed under Title V or we need to proceed under Title I, at least temporarily. So as part of that, either way, you negotiate an agreement with the Indian Health Service. There's a standard contract for Title I. You have one in your master health contract. It's a standard contract. And then where you put, the negotiation occurs in the annual funding agreement. That's another difference too. In Title I, you have to have a funding agreement every year. You have to renegotiate that funding every year. At the end of the year, if you don't have a new funding agreement, the IHS won't pay you, right? Under Title V, there's a provision where the IHS is obligated to keep paying you even if your agreement has expired. And under Title V, you can also have a multi-year funding agreement, which means that you don't have to go back to the IHS. You can have a 3-year funding agreement or a 5-year funding agreement, in which case, the IHS is not there at the negotiating table on an annual basis. So it gives you a little bit more autonomy from the IHS. And so for all of them, you need what's called a scope of work, and that's basically just a description as to what you're going to do. You have a scope of work in your existing master health contract. It says all of the different things that you've agreed to provide. All the different programs, they're called programs, functions, services, and activities. That's the language used in the Indian Self-Determination Act. But it's the functions of the clinic, of the hospital, the program that you're agreeing to take on. And so that scope of work would be reflective of what's currently occurring at the hospital. And what tribes do when they take over a program like a hospital is they usually will have a scope of work that describes what is currently occurring at the hospital. And then that scope of work gets amended over the years to expand services, right? To maybe bring back some services that, the facility is no longer providing, if the funding is, is there to justify that going forward. So, one of the other things in a scope of work which is important to note is that you can add services that the IHS does not fund, if you can fund it with other sources of funding, like third-party resources. A lot of tribes have started providing long-term care facilities, for example. There's no IHS money for long-term care, but you can put it in your contract and funding agreement if you want to, in order to and get funding, as long as you can fund it with other sources of funding. And most tribes use Medicare and Medicaid to pay for that. So those are things that, when you start taking over a program like that, it's usually a pretty basic document. The other thing to think about in these agreements and the funding agreements and the annual funding agreements is what policies and procedures you want to follow. One of the advantages of contracting or compacting is you don't have to follow the IHS manuals or regulation or internal policies. You have to follow their eligibility regulations and that sort of thing, but you don't have to follow, you set your own, exactly. So what a lot of folks do when they take over a policy, they'll maybe maintain a lot of them right now because the employees there are used to following their policies, but then once you get in there and you see what's working and what's not, you can then alter the policies and create your own.
Go ahead, Michael. So what do you mean by eligibility requirements?
Oh, that's who is eligible to receive services at an IHS facility. So that's
So we have to follow IHS limits through when we assume, or can we change those eligibility requirements at some point?
well, no. So the IHS requires that you serve all American Indians and Alaska Natives who present, as well as descendants who are members of the community being served, and there's a regulation on that. But you have the ability to interpret that community. You get to set what that is.
And
Just one. You also, once you take tribes that take over programs, they don't have to, but some tribes take over programs, they do elect to serve some non-IHS beneficiaries, non-Indians, in their communities. And so employees maybe, or that sort of thing. So you can do that so long as they pay for the service. So you're not taking IHS money away from, a Native person. Right, exactly. That's right.
And that's known as a 813 waiver, and many tribes have utilized that, and the board moving down that road would,
But we're not discussing that now.
Yeah, okay.
That's not.
So, yeah. The other is either of these approaches, whether it's a contract or compact, then address the treaty and how that's stated in a agreement.
Yeah. So the Indian Self-Determination Act, at the assistance of the tribes that were drafting it, included provisions that specifically state that the law does not diminish in any way the trust or treaty responsibility of the United States to provide health care for American Indians and Alaska Natives. And that's language that we insist putting in all of the funding agreements or annual, AFAs that we negotiate. So.
Got a tribal member that wants the floor. Daryl? Somebody get the floor for Daryl? What, Daryl?
Here's the mic, sir.
Can you hear me? Pretty good. Okay. Excuse me. I'm on my way Valentine to the bank, but I thought I'd stop in here and give my opinion. I apologize. I'm dealing with not COVID. It's just what I've been through in 1995. myself and the law firm I hired, myself and another tribal member from Pine Ridge and Cheyenne River, we sued IHS, HHS, and the United States government. There's only 3 people, tribal members of all the Great Plains, have ever won a lawsuit against the United States government for health care, and I'm one of them. I am standing here because of my own strength. I was a code blue within that process of what happened to me. I was a code blue twice. This happened in April 1995. And right now, every once in a while, I have difficulty talking because of all the tubes that went down my throat. It affected my speech, affected my clarity on saying stuff at times. So every morning I pray to give me a voice to say something, say some words. And this morning it was very tough for me because I have to drink a lot of tea in order for my vocal cords just to say some words. I'm getting to a point where I'm going to ask IHS to help me out in this direction, try to do something for me. I've listened to you all this morning in the council. I am probably 3/4 for this, and the other is still for IHS. The reason I'm saying that is because I don't want the treaty to go away from our hands. If you can show me, you and your firm and your legal counsel, show me some documentation just based on treaty to what you're talking about to make this happen for our tribe, I would be content. Because I used the treaty in 95 to 98 when we settled in court, federal court, for damages and everything. I used the treaty and that helped me. Treaty is our only hope of arrows that we have in our grasp to how we live. If Congress takes that treaty away from us, in which they can't or they can, because at some point in time, every time we get up, we all walk out that door and thinking, is Congress going to take away everything, the BIA and the IHS program? With things going on with what's happening with the war today and everything else in the United States, it'll take a rogue president in Congress, Republicans, to take all this away, and there'll be a legal battle. But I need something from you to give me that this treaty is bound and we'll never lose it. Because if this happens, the ramifications that your firm started here with whoever started this thing, IHS is going to slowly come back, but they're going to be all damaged up. You have holes all over them. And this program you're developing is just going to blow in the wind. So if you're going to make this thing work, make sure you make that treaty its own policy and documentation. That will strengthen that. If you don't, and I don't see anything other than that treaty within helping that, I'll come back in here and you'll see some lawyers behind me. I know how they work. I worked with them for 4 years. I know the legal system. I sat here. I sat here with men and women that were powerful men in mind, in heart, and in strength. I always liked this gentleman here, where he came from. I believe it was your grandma, the elder. Huh? Christine Dunham. If she was still here, she would have been in here and saying, you make sure this works. Don't. I'm going to make a motion here and grab an attorney, and we're going to come after you. Eddie Farmer, Lionel Bordeaux, and my brother, Mr. Shadow Wright, Leonard. All these great minds way back then, that what we fought for, and I'm really pleased right now of these young men and women that are in here. Strong minds. I'm grateful they're doing this, but I am really worried about our treaty. I am hoping that all the rest of the Lakota tribes that are in the treaty base are saying right now to themselves at home or wherever they are, the Oglala's and Shannon River, what are those Sioux tribe people doing? They're going to mess it up for us on this treaty funding, so forth. But I hope we don't. I hope the package you bring today stands strong, but if it don't, those same tribes are going to come after us. They got to tear us apart. We're part of the Ocheti Shakoni, but I tell you what, you don't want to mess with our relatives out there. So by closing here, that team must be working because now I can hear my voice a little more. I pray every day when I drive by here. I thank the men and women in here in the administration. That something good's going to happen for us. A lot of the money that's going in and out, wherever it's going, needs to come back and strengthen our people first. The way we live, our homes, that's part of health care. We need a lot more emphasis on this young lady here, if she's going to be our health care program director. And I see here, I'm sorry, taking a little time, that the health board wasn't really mentioned here. I think the health board is a very big key here. And whoever the chairman is needs to coincide with everybody. Need to strengthen the health board committee to give any more structured business deals that we have. So please, I'm not asking you, I'm just here for the treaty. Make that documentation strong as it can be and stay that way. Because if you don't, we're going to hear it. And in the end, you're going to hear it. And believe it or not, you'll go to jail. You will go to jail. With that, I'd like to end my thing here with a little prayer, if you can hear me out. Atukashila. Wayan betuki e uchozanina. E woga ke woksa pehna. E wapi tankamale. Itokam indoji. Ataku na ye oyate na shichanku na ye ocheti shakoi oyate na. Ataku washe na egna kavantish. Onke bantoshtikte. Ash letaku ya wana inke ochekya egna kinaya. Anse taku na ichupichanta tukashla. Anse ocheti shakoi na joktelo. Au mitakiase. Thank you.
I'm gonna finish the slides, finish with them before we do lunch. I
yeah.
know there's a request that people are diabetic and they need their, eat at certain times, so, if we can let them get through the slides and ask some more questions, and then we'll brief for lunch. Okay. Go ahead. Ally, can you speak to some of the things that, Mr. Marcus had said about the treaties? Is that gonna be a problem?
No, I mean, it was a very heartfelt and important statement to make. Just we would never advise any one of our tribal clients to ever take any action which would jeopardize a treaty right. Period. Full stop. The Indian Self-Determination Act contains language in itself, and that's the law that governs these agreements. Title I and Title V, it's the Self-Determination Act, contains language specifically stating that entering into an agreement, that if you enter into an agreement, you are not giving up any trust or treaty responsibility. But in addition to that, there are these agreements that you would negotiate with the IHS, and we would include that language in those agreements. Period. With a specific reference to, your treaty. So.
Keith, our Sergeant at Arms has a question.
Sir. Good afternoon.
In this compact, looking further, what's talked about employees there will be better doctors in each department of the hospital. Secondly, I know treaty's an issue, but the treaty says better health care for local people here on the reservation throughout 1850 to uphold the trust responsibility. And those are one of the questions that hopefully that we get better doctors. Well, that's the question, is will we get more doctors in our department, because IHS is really short on doctors. That's one of the questions.
There's the operations question.
Yeah, this is an operations question, and recruitment is a difficult process. But under a program entity of the tribe, the board, you're not going to have the same regulatory issues of bringing a healthcare provider into the community. You want someone that's competent, that's safe in your community, developing various type of employment packages, salary range, to actually recruit people. And there are individuals, and we talk about physicians, nurse practitioners. There's all kinds of healthcare practitioners that make up your organization, and recruiting these are very technical. I've not done an analysis around practical experience. I'm a healthcare operations guy, tribal healthcare. We always seem to do a better job at recruiting and retaining staff across the board against the Indian Health Service. So, dental is a big vacancy area. And, don't have a crystal ball, but I would think there would be some level of improved success in securing healthcare providers. As I alluded to earlier, Dr. Toby, and I'm sure you're aware of him, he's has a with the Tribal Health Administration. program, and also with the Indian Health Service. He comes out, I believe, every other week and is a hospitalist in the facility. And in some of our sessions, and I described this earlier, he's talked about the problem of recruiting, well, not being able to hire the residents that they brought out here who were interested in coming here. That will not be a problem under the system. You'll be able to bring them on. And now, housing, we haven't looked into what the Indian Health Service has in the way of housing, because that's something that you'd be placing, or the system would be placing these people in housing, or where they choose to live in Valentine or another community. That's pretty much up to them. But as a tribal healthcare operator, and Tribal Health Alliance has on occasion been the executive department for a tribe's health system. So we've brought our team in to help that, and we've been able to recruit people, because you're going to be able to be a little more aggressive in that, and provide better packages. Yeah.
Chris, and then have Lila. Go ahead, Chris.
I have two questions. First one is, with all these other hospitals across Indian country that you guys have, done this with, how many of the staff that were there prior to the compacting actually stayed, that you guys can have maybe the rest estimate about? And how many doctors are actually full-time there versus back when they were still at AHS? And then my second question is, the man that came up, he had a question about, he brought up liability that they ended up suing IHS. Well, whenever that goes into the Rosebud Sioux tribe, they'll be able to sue us as a entity for inadequate services and something that we might fall in. And well, unfortunately, these are the things that we have to, ask, because how will we go forward in that? And that's probably, I don't know if that's a question for you guys or if that's a question for us, but.
Well, the second question definitely for Elliot, not me. The first one, regarding hiring of the staff. Is that what your question was?
No.
Oh.
How many folks stayed on?
Stayed on, yeah, that. In my experience, the only employees that didn't stay on in an IPA or an MOU are those, even if they were eligible, that the tribe felt they did not want to be delivering health care in their community. Now, that's a pretty big, hard decision when you're saying, we're going to say goodbye to somebody, because you're opening up a vacancy. And so we've not seen, and the other side of that are those that are in their mid-career with the Indian Health Service, and they're looking at a promotion, and we'd want to be looking at whom those individuals are and how we could recruit them to stay in this healthcare system, but then they may want to leave it and go work somewhere else. And that does create a vacancy. Thank you.
To your question about lawsuits, that's a good question. So you are correct that if it's the tribe operating the hospital and something happens, a provider, is negligent, the lawsuit would be brought against the tribe, against the hospital, right? But under the law, under the 638 law, the Indian Self-Determination Act, the United States retains the responsibility of defending that lawsuit under a provision called the Federal Tort Claims Act. So just like IHS, the United States attorney would come in and defend the tribe and that doctor against those claims. But for whatever reason, most tribes will also carry some wraparound insurance, just in order to protect itself in the event that the suit doesn't go well. So.
Lila, do you have a comment?
Thank you, Mr. Chairman. I want to say, welcome to the visitors that are here. Nadona ala nakapi kila awo pilat kankai chuchapi. Okuja tipi kila iwon glakapikta.
Toshke da ichuk umpteki hena echalel iwon't lakapi. I'm letting our people know what we are talking about. And as you come here in our arena, we always are gonna be defensive. And I myself, like I said, I think Lakota, I think about all of that, what happened. And there was some good questions that some relatives out there asked me to ask the council, and as well as you gentlemen and our admin. They said, why didn't this come to the people first? Question number one, and that goes back to us as a body. Secondly, there are a lot of tort claims that were filed with, what do you call it? With IHS and mismanagement, inadequate health care. There are people who lost their lives as well. And there are all these issues sitting there waiting. You know, people are waiting. And then now we're talking about going into this. We have people who are still getting bills, you know, and that just comes far and few between. We have to resolve that in here somewhere. Because if that's still happening and we approve this, you know, that's a huge thing because it affects our people. And Skyla has been helping with that, with our bills. So I encourage everybody out there, if you have bills coming to you, bring those to Health Administration. That way she can look into it and take care of it. But you know, the treaty is really all we have to stand on to carry us this far in the future. We speak a different language, but we have a right to the best health care that the government can provide. That is a human right. Health care is a human right. Our people are leery, like I said, because of the diversion we had. And it was under Mr. Kendall's administration, and I did sit here that time. The 11th hour, we were sitting here, they shut it down up there. We didn't know nothing. We cannot have that kind of communication. There was no respect for us as our own tribe, our sovereign nation, to even give our chairman a phone call. But they just shut us down. The treaty protects us. If it's read right, it will take care of us like it did our relatives. They sued and they won. I myself, sitting here, have a lot going on in my head. I'm sure my colleagues all do as well. This issue is a huge issue. It is our livelihood of our relatives, our elders, our future. And right now, our babies are not being born here. And that's getting taken care of. But that will affect us down the road because we are a spiritual people. We are a tribe. We have cultural laws that have to be followed for wellness, mental health,
all of this. Right now, we are really suffering because things have been promised to us as usual, but they're not being executed. That's not your fault. You're just here to do this job, but I want to give you this information because it is real. You're asking 30,000 members of the Rosebud Sioux tribe to trust you. We're asking our own people to trust us to make that decision for them. So I don't take this lightly. I don't tread on it very lightly. Our elders are the ones who have that say-so. They have the say-so to guide us through this. I'm scared. I'm worried. We don't know. I can't foresee the future. But when we sit here, we are obligated by our tribal constitution to look out for the next 7 generations. That is an obligation that each and every one of us here have to our people. I have friends who work at the hospital. You know, they've been there years. My fear is there will be a huge turnover with our healthcare system. We already have it with our doctors. We can't even get a doctor, a podiatrist here. We can't get physical therapy here. Those issues are real and happening as I speak. I got another text about amputees. The government made a decision, life or limb. Wow. So now we have people who are amputee patients. A part of their spirit and their soul has been removed. That hurts a person. We have cultural laws that need to be followed. We have our treaty people. We have our elders. So we also, as Lakota people, have a hierarchy that we are obligated to follow. IRA is not a traditional government. And we need to use it to help us as well. That's why we're this far. But we have to be very cautious of what we're doing. And I was speaking for relatives who have been messaging me. And they said, pay attention. Pay attention. Listen to us. And that's something I want to relay to my colleagues in our admin, that's what the people are asking. And with a good heart, you know, I know we're doing the best we can for our people, but let you know it's not a light decision. So I had some copies made for council, just information. This one was the difference between contracting and Title V, just to give to us. This other one is info on questions that have been asked when it comes to self-governance. Our sovereignty is very crucial to us. We cannot sell ourselves out, because that's the other thing we have with our treaty, is our sovereignty. We pay a lot of lawyers good money to protect our tribe. And I wish we had them here today, council. I wish, you know, we had some legal people here. I don't know if Eric is busy or if he can be available. I think it's important to have him here too. So those are just comments that I had from our relatives. Thank you.
Back there, if we need somebody to get her to the floor, and then it's Dara.
Kind of piggybacking off of Lila's first comment on ABLs earlier, mentioned that it appeared with the financials of IHS that they look, IHS is pretty solvent. So why do we have bills that aren't being paid?
That's a PRC problem, because they don't.
Yeah.
I mean, you're not
Yeah.
IHS, but
But understand process. The Indian Health Service, that's a PRC issue, and I'm going to go out on a limb and state my assumption is they were approved for a service, and yet it's taking the Indian Health Service way too long to see that that bill's paid. And that's a very complex organizational issue. The Indian Health Service is in a contract with Blue Cross Blue Shield as their fiscal intermediary. And so this service unit is probably mailing bills to Albuquerque, and then they're transacting them, and it.
Policy is actually called AE of last resort.
Correct. That's right. And so the service unit should be making sure that that person is signed up for all types of things there.
Would we have to follow that?
Yeah, go ahead.
Sorry.
I don't know.
Well, I will just say this, the Purchase Referred Care Program is done at the area office here in the Great Plains. That's not the case elsewhere. And it's a problem not just for you, it's a problem for the other tribes in this area. It's a really big problem, right? The current IHS director talked about this problem at the Secretary's Tribal Advisory Committee meetings that were in Rapid City a couple of weeks ago. And so it's a huge problem in terms of the IHS just not processing the claims quickly enough. And all of your relatives are suffering, and it's been a problem that's gone on for years in this area. Tribes that take over their own programs are able to run the PRC programs themselves, right? And so that means bringing in, most tribes when they assume programs, they bring in lots more billers, more staff to be able to process these things. But that, you're right, that is an issue. It's called payer of last resort, meaning the PRC dollars pay last. So you need billers to be in there processing, to make sure if somebody has insurance or if they have Medicaid, those pay first. So you save the IHS dollar, right, to provide more services to more people. That's the point of the law. And tribes operating would be subject to that law, but you're processing the claims yourself or hiring other outfits to come in and help you process claims. And so that's a difference. So.
does that, and that goes back to the lack of IHS having like coders to help, does that contribute to that process too, the coders?
Or patient benefit advocates that look at resources that are out there and signing people up for resources, because you have to kind of be declined by Medicaid, and then that might push, they may be what we call PRC dependent. They may not qualify or have health insurance, and so PRC would take care of it. But even then, the complicated process to get the bill paid is something, and so we'd be recommending a change, moving away from the Blue Cross, utilizing another system that would help with the repricing, uploading claims, and they typically
Just a whole new system.
And pretty much their system, it's really the service unit or the facility would still say, yes, we issued this, here it is, here's the bill, and this group would reprice it because you're eligible for repricing, and then they would come to you and say, this is what you owe, or they would be like Blue Cross even cuts the check or warrants, and this company gets things done in about a 30-day process versus 90.
Okay.
78 to 90 days with Blue Cross Blue Shield.
Okay. And then in the beginning of the presentation, you talked about the employee payback program. So what is it payback or buyback?
Buyback. Yeah.
Program. So the salaries for the staff on top will be cut from the budget, or how does that work?
It's an expense on your books, and the Indian Health Service will invoice the healthcare system for those individuals. So we're paying a bill, or you're paying a bill.
And then, so the money that's left is for like the PSFAs, that for the services? and
Yeah.
That's what the
Yeah.
leftover money is gonna be used for? Okay. With going to the lawsuit, you know, the tribe was successfully sued IHS. But what's frustrating is that we didn't ask for anything in that lawsuit. When you guys came the last time, we had discussions on if we can use the lawsuit that we won to pressure and use it for, you know, negotiating with IHS or whatever. Is that something that we could use this lawsuit moving forward?
Yeah, I think Dan Prue, who's also part of this process, I know that he's been having some discussions with congressional delegation to try to use that lawsuit in order to get a joint venture, which is a staffing package from the IHS, and use that leverage with Congress to get additional funding for the program. So, but I defer those questions to him. Yeah, I'm just here to do the negotiation.
Wayne and I both attended a meeting down there with Senator Thune, and we talked about joint venture, compacting, and we want to be successful, so we talked a little bit about our lawsuit, what that meant to him as far as winning that lawsuit and providing that better health care that they're supposed to provide for us, for our treaties. And his comments to that was that bring us a plan, what you guys want to do. He will create legislation based off our lawsuit to give us what we need. And that came straight from the Senator Thune, so I don't know if that answered your question or not.
Yeah. Next, like, and then including the treaty within what our elder came in and talked about, and what Lila talked about. You know, when we amended, going through our amendments with our education code here and with our education committee ordinance, one of the amendments was including the treaty in that, because education is also a treaty right. So we can do it and we should do it. The other thing too, with the community education going through this compacting process, Skyla, I know, or correct me if I'm wrong, but the second round of, or maybe you have the grant that you got to pay for this, was it the second round of funding that we approved of, maybe the beginning of last year? Wasn't that strictly community engagement and to complete the community assessment, and how did that go?
So, to put that information to get that corrected, so what happened was we got a TMG planning grant, and it was the community assessment.
Yeah.
Okay, so what happened in that sense there was that we got a TMG planning grant, and it was for like a total of 83,000, I think, 900 or 800. And so with that got awarded, it was to do community assessment. That's what it was. To do assessment out there. So Dr. Warren and Jared LaFont from Rivera, they came and we awarded the contract to Rivera, but Dr. Warren assisted with it. And they just targeted what it was just when they did that part of the assessment piece of it, was just to target certain groups that the large out of the population here. So they targeted SGU, I believe. They did DPP staff. They did the elderlies. I think it was elderly nutrition, and at that time it was Malady that was the CEO at IHS, and they attempted to go over there to try to target, you know, the IHS people, but they were stopped. So that piece didn't happen. But I do know that these other categories that did happen, it kind of targeted like the elderly people, because they're the elders of our community. So that was kind of the selection that we decided, or that they decided that they should target.
So I do know that they did go to the elderly pieces of it, and in lieu of all of that, I think they were provided like a $50 gift card and whatnot and stuff, so. But that was a separate grant away from this planning grant for the compacting. So this compacting grant that we have is a 3-year grant, and it's to pay for the services that these guys are providing here and to get the compacting going. So the work that's been done thus far for the last 2 years hasn't been at the expense of the tribe. It's been at the expense of the grants that have been applied for, and they were approved for the compacting. So that's why we were able to progress as far as we have with it as of today versus when we started it 2 years ago. Because if we didn't have these grants, we would have been fumbling for, money and getting some of that startup costs going. But then these grants were like a supplement to help us get this started. And this is to the point where we're at with it. So this is where Tribal Alliance provides the services, and they get paid through my office through contract.
Because a lot of us have concerns, we've expressed it as far as the community engagement piece and getting information out, so how can your office or how can we better get information like this out regarding this compacting information?
So we started, the initial intent was to just go to like the smaller communities. That was kind of our game plan. But then we had to deviate from that game plan a little bit, because I think it was August 2nd, I think. We were invited, I got a letter from Melinda to go to Antelope Community, so we did. Then they had a list of these questions when we got there. It was me, Eric Emery, and Dan Prue that went there. They had 10 questions for us that was already written, so then I was the one that read the questions off, and then they just provided answers. And then we waited for the the people that were there. There was actually I think 16 community members of Antelope that were there besides other outside people. So what we did was we answered to the best to what they wanted on those questions, and there was 10 of them. There was a couple of them that was kind of a repeat of one question, so we just kind of skipped that because it was just worded differently, but basically the same question. So we just answered the best that we could there, and then we were going to go to starting with the smaller ones, and then we were going to venture out to the bigger communities because we needed to have more time to that.
So how can we get the information now?
So what we're going to do is, initially we had a Q&A because that way it's straight to the point, you get a direct answer, and it's not a time to have a room for debate. But then I don't know what happened. We don't control that piece of it, but it did happen. We had a Q&A that lasted for a half hour, and then I don't know what happened. Something crashed on it or something, or it went down on it. So because then remember, it was like how COVID was. You did a Q&A and then people had those concerns and questions. So that we wanted to treat it something like that. It's not COVID, but we still felt like it gave people an opportunity to call in and ask their questions, and then we would provide an answer. Because we had the Zoom link set up for these guys to be on there as well, because they couldn't make it in person. And then so that's kind of how we wanted to do it, but then they never reached back to us to see when they could put us back on for air again. So now that we're at this point, what we're gonna do is target the smaller communities, and I think they wanted to combine one community right away. We were gonna combine Upper Cumming, Hedog, and then we were gonna go to Parmalee. So we were just gonna work our way down around, but like I said, the bigger communities, I think we need just to have a bigger time, like maybe a day or two in that community because of the big part of it. But then again, we really want to encourage the tribal members to voice their concerns and come to those meetings, and we'll announce it. But what's going on, and we noticed that, is that there's just a handful of community members that speak. So like for an example, if you have a community that has 800 members, there's only 20 people that show up and speak for that. So if there's really a concern and people have that concern, that's the time and the opportunity to come and voice your concern rather than just this handful of people. Because then what we get the backlash, because we're like, well, why did you listen to them 20 people? They didn't speak for me. That's the kind of stuff that we get. So what we want to do is we're looking at a different mechanism to put like a short synopsis in a paper about the compacting. So we're probably looking, I'm waiting for the quote from Taw County Tribune, and then however we could get it out, even on our Facebook, to describe and to see from kind of like how we are from to what we're at, now, what we were doing 2 years ago. And there's different ways of getting that, and then also we're thinking about reaching out for Chris to actually, and Dr. Warren or somebody from the SOHS Chartered Board, to do a PSA, and then we could play it on the radio. And then in my opinion, I guess, all of that needs to become to this, to start putting it out publicly. But again, when we go out to the communities, I encourage the community members to please come and voice your concerns and not just have a handful of people speaking for other people. I mean, speaking for the community in general, because you still are faced with the fact of I'm not getting, or they have questions but no answers. So, everybody's provided a door of opportunity to come ask questions and what have you.
So just to clarify, you do have a plan to reach out to the communities so they have an opportunity to express questions, concerns, input, whatever.
So everything that I have done thus far, I've been with Health Administration for 16 years. And so I have a...
I just wanted to make sure.
But no, I'm gonna get to what I was trying to point out to you. So I always, when everything that I do here today, or even, when I started as the director, I envision everything as if, if it was you doing the compacting or anything. I've envisioned that, I would want these questions answered. So by all means, I'm from here, I'm born and raised here, so I'm like you, and I know the people's frustration, that, they have questions, no answers. So, if it was vice versa, and if it was me on the other side of the fence, I would be frustrated like them. So by all means, I am compassionate about their concerns. And it's not that we're ignoring it or we're not trying to be informal to them. We're gonna make it a point to be informal. And then when Lila got up and she made her statements, my parents were from Parmalee, they're elders. I'm fortunate to have my parents here. And there's just a lot of things that I could relate to because I'm a tribal member here. So just because we are in these positions or I'm the health director doesn't make me exempt from those concerns out there. So I always envision that what it would be like for me if I wasn't a health director or if I was an employee, I was just a simple tribal member and I had these concerns. I would want answers too. So we're trying to combat, and we have a plan in place. We just need to throw it into action and get these information out there to the people, and that's what we want to do. And like I said, I'm encouraging tribal members to come, because there's a lot of misinformation and a lot of miscommunication out there, but the only way to combat that is if you come, ask, and get your answers. But right now, we're just listening to innuendos, and that's really bad, and I feel bad for the people, but that's our job to get that communication out there. So we're gonna work on it, and I've shared that with the health board members, so just so you know. Okay.
And then my last question is, because we contract out our emergency room, what's that gonna look like if we
I think it's an operational plan. But then also you create full-time staff.
Okay.
Yeah.
So that, because I know there was a situation that happened about 6 months ago, and we have it, as far as I know, the leaders that I reached out to, the tribe doesn't have the contract for the ER. We can't find it anywhere.
Oh.
So, and that came from our health administrator and the chief of staff. So is that gonna be, I mean, if we continue to contract, because our ER has a lot of issues, And we try to address those issues when we get those phone calls, but I myself, as a council rep, when I ask for that contract, we can't get it. An area office, for whatever reason, won't give it up, and I don't know if it comes from area or from headquarters.
Interesting statement. We have the same dilemma because part of our fact finding is to review contracts, at least scope of works that have allocation and budgeted obligations to it. So we're getting that information and working with Elliot and his firm is, those would be contracts that would be coming over to the tribal organization and be redone. So, that's a lot of work up front before day one, because whatever assumption day is, the next day after that, you're liable for, or the organization is liable for those expenses.
Get that contract, can you share it with us? That's all I have.
Yay!
We have Melinda, travel member, which needs the floor. Go ahead, Melinda.
Good afternoon, everybody. I'm Melinda from Adult Community. I guess the billing question was kind of answered with Micah and Lila here, but what's going to happen with individuals that don't have insurance? There's a lot of them out there, our tribal members that don't have insurance to cover. So what's going to happen with that? As far as, being invited to an adult community meeting, 10 questions was provided to you, and you could only answer 4 of them. Remember, 6 of them you said you couldn't provide the answers to. I think more advertising, like Michael had mentioned, adequate advertising. We have people out there that do want to come, but we got wind of this last night. They do have questions and they do want to come. And another question is IHS employees. Why are they to have a gag order? Can't they come to these Q&As without being disciplined to ask these questions? They work over there. They have questions and concerns too. They shouldn't have a gag order to be able to come and ask these questions. I think mainly just the billing, right? Is that they were questioning on, and the employee status is what they have. Huh? The union? Oh, okay. Yeah, so that's the main questions. There's just more adequate advertising. None of the questions, there was 4 of them out of 6 that was answered at the community meeting at that level. So, we just need more timing, and that's what the resolution, we're not bullying people. I guess that's what was mentioned last night, but, I speak on behalf of the people, and that's what we went on record to oppose it just till we get more information, because we're not provided all the information. All we was told was we can't answer that. So we just need more information, but that's what we wanted to go on record for, to oppose it till we get more information from everybody. But we've got complained that we was bullying, but we're not bullying anybody. It's just a question that the people have. Thank you, council and administration.
Bill wants the floor back there. And then Sarah.
Good morning, guys. My name is Sarah. I'm in the Smithfield community over in White River. The 3 questions that were asked are very important. According to Article 13, we're guaranteed the physician, the farmer, the miller, the engineer. We're guaranteed those rights. And for a long time, until 1921, when the Snyder Act came up, there wasn't no line items that were appropriated. And then in 54, I think it was called the Transfer Act came. And that's how the Department of Health and Human Services first bring out IHS. My mother was born that year. She was born at home in a tent along the White River. And so she was blessed that way. But when that IHS came in, she had to utilize it. So when IHS came in, I lost an aunt because of the emergency room. They misdiagnosed her, so she sat there all day as a diabetic, and she ended up being an amputee. And then my own mother was misdiagnosed by the pharmacy. She was told to take so many cc's for her insulin, and it was way too much. So I helped blow my own mother's pancreas out because of IHS. None of those treaty obligations were held to. Those trust obligations, none of them were held to. The gentleman who sued them, you know, won't be like. There's a few more that did that. Had a young gal that, when I taught tribal laws, treaties, and government, she was my student. She went in there, and that ER doc told her she was lying. You're not in labor. So she used the bathroom, and she had her baby in the toilet. And she sued IHS, and she won. So these kinds of problems, you know, we're facing with. And so what do you two men think you can do for our Oyate? Huh? What can you do for us that IHS hasn't done already? They haven't done nothing. So here you are, she brought a good point. We're letting you two men control our lives, our health care. You're coming in here in your suits, you're talking all these $1 million words, but I don't hear nothing about the compassion for our people, even our own tribal members. The health board, that was like gods, just like the ARPA board. There was a lot of miscommunication even between the members here. Now we have issues about the Oyate. Nobody got wind of anything. You know, so where were you guys? Where was your intent? If you want to come in here and prove all of your magic to our people, then why weren't you out there with our people? Why didn't you send someone? So I got, you know, I have relatives. I have a nephew. Waited 2 years to be referred out for one x-ray on his back. What makes you guys any different? What you gonna do for my family? Because this is all my relatives. What are you gonna do for our people that is different from IHS? And I'm not getting mad at you. I'm voicing an opinion that comes straight from the land. So I want you guys to tell us in a good way what your natural intentions are. And if that way isn't for our well-being, because they talk about 7 generations, we need to times that by 7. The next 149 generations need to be alive as Sichungu. And so you two gentlemen have a lot in front of you to come in here and try to convince an Oyate to follow you. So I hope your ducks are in a row. I hope you even got some buffalo, because we're gonna butcher that when you mess up. So I hope to God, Wakantaka, that you came here with a bigger plan, because we need help.
I want to remind you guys, this is a consultant firm. They're here to help us through the process. They're called Tribal Health Alliance. They're not the person that we need to be chewing out today. So
it's not a chewing out. These are questions that the people
but the way
need
you
to
present
hear.
yourself, Dara, it's like you're chewing them out. So
Well, I'm sorry.
Okay.
When I am mad, let's see what happens then.
Okay. Thank you. We have Phil. Somebody get the floor for Phil.
People used to get their way. Sometimes that easy.
Microphone stand here too, please. Just kidding. Just kidding. My name is Philip Little Thunder. I'm also a member of the Treaty Council, and I'm also a United States veteran, and I'm also the elder now. I am service-connected veteran, so I get my health care any place. I'm mainly a veteran winner. But sitting here listening, and it was an honor to me that young lady back there asked my opinion about what's going on. And at first I was thinking corporate takeover. I don't know why I was thinking that, but you know, I also have a first cousin that died on his way to Valentine, Nebraska from Mission. Whereas he could have been brought to Rosebud. He could have been brought to Rosebud and saved his life at the emergency room. And they mentioned that emergency room was closed that time, so they had to ship him to Valentine, and he died on the way. And I'm concerned for my relatives on this reservation. That, you know, my first thought was during the rollover or switchover from administration,
that the ER or doctors might, take off for a better place, or, to ER to close down again for the people. And as I mentioned, I'm part of the Treaty Council, and, I was around when our elder, the ancient ones about Simon Broken Leg, Eugene Crow, and all those guys used to sit there and talk about treaties with my dad, Victor Little Thunder Sr. He was a tribal councilman here back in the 70s. So maybe that's why I'm interested in what's going on with our people. But my comment on the treaty thing was that, as Ate up there knows, that the contracts, the contract, with that treaty should be inserted there. That word treaty should be inserted with the contract. Treaty/contract. That way we can all be included, our people. That's what they understand up there, the word contract. And if you say treaty, that's just Indian people using their word treaty. But if they put a slash in there and put the contract in there, and through my living the 66 years of my life here, I've always had a backup plan, as far as my life is concerned. My furnace gave out, I got an electric plug-in heater that's going for me. I might even try to get a wood stove to keep me warm during the winter. But, some of the things that I talked about, the health administration, I've been up there last part of July, as my Tanshi mentioned, his throat got injured, and I also got my throat injured too. I ended up in the ER because of a health issue, and I had tubes stuck down my throat. There was no doctor present, I don't think, but next thing I know, I'm on an airplane to Rapid City Monument, and I think that costed $8,000 or something for a can of Pepsi that costed maybe $1.50. So when I got there, the doctor came in with a can of Pepsi and gave it to me. And so I drank that, and my throat went okay, and then my lung cleared up. And so, think about $1.50 of Pepsi versus an $8,000 trip on an airplane. Whereas they could fix me up right there with the can of Pepsi if somebody knew what they were doing. So that's what I was going to bring up, because, up till today, my throat still hurts sometimes, and, because all them tubes that got inserted. I should have been flew to Hot Springs or Fort Meade, but they just took me to Monument. But that's my opinion on the switch over for people, is to have a backup plan. Whatever goes on in administration, that ER should stay open forever. Because I lost one of my first cousins that way, and growing up with him, he was our protector and our leader, but alcohol took him out, and I know what that does to our people. And I want to also advocate strongly for that detox center up there. I have 6 family members that are adults out there, want to come home. They're addicted to drugs and alcohol, but they need help to get cleaned out. And so I want to ask the council to, really push for that detox center to be open pretty soon, so, people can get help. And I also was in a detox center for, 2 weeks, cleaned me out, sent me to the VA hospital, 4 months. And that's why I'm standing here after 31 years of, recovery, that the health administration helped me. So I want to thank the council and Itacha for giving me this time to voice my opinion on this matter. Our people are the ones that are out there that don't have voices or can't get here. So I want to thank everybody again.
Thank you.
Thank you. First of all, Scott, you already clarified it. You two ain't running the hospital, okay? Well, actually, I'm gonna back up. Keith, I really need you to control the room as Sergeant of Arms. When people yell and start raising their voice, when I do it, you're quick to say, you know, point of order, and I try my best to respect that. So if you could please make sure that you control the room. Raised voices trigger a lot of people, so thank you in advance for doing that. I feel like the people think today is the only day that they're going to get the opportunity to talk, so that's not true. Skyla just said that there's going to be much more opportunities for the people to voice their opinions in your community or wherever that she decides to set the meetings up for Q&A. Skyla, would you please set a schedule, get that schedule out on Facebook, RST Communications, on the radio, both radio stations, and have the link shared with all the council so we could share those dates as well. So the people have a set schedule. That would be really wonderful. When we have that set schedule and you have the people come, besides just these two gentlemen, do you think that you could include Dr. Toby in those? So I wanted to just let some of the council and my colleagues and the people listening know that I am tired of IHS. I am sick and tired of IHS. I needed a heart monitor, and it would have costed them $5,000, but because IHS is funded at 51% of their requested budget, I was denied that. Okay, I'm alive, I'm okay here today. But what happened is, my whole life I had atrial fibrillation, and if they would have granted me that heart monitor, they would have saved themselves $80,000, because that's how much it costed to fly me out. And then the extra $5,000 to get me from their ambulance to take me to Monument Health to save my life. And then the hospital stay that they ended up getting billed, because the $80,000, that was just the flight. So, you know, those things are wrapped up in the red tape of the government, of IHS. You know, we say that here all the time. Government shouldn't run businesses. Unfortunately, in America, hospitals are businesses. That's how they sustain, to pay doctors well, to pay their nurses, to pay their staff. And through this healthcare crisis that we've been having, it's been very difficult to bring people in and keep and retain people. We also have a huge issue here that we've been facing. Doctors, how are we going to get these doctors? How are we going to get them? People who make $100,000, $200,000, do they want to live in a desolate area that has no local economy where they can buy their Starbucks, spend their money? Schools that are, you know, not up to par, where they could send their schools, no option for private schools. These are the real issues that we're having. Now, we all have our ideas and opinions. Why can't we just fly in a doctor to come in once a week? We can't, because IHS has red tape. But if we compact, then we can. We have more flexibility. And when I talked to Dr. Toby, I said, why did you leave the Boston doctor crew? Why aren't you coming here anymore? And he said, because under IHS, there is no change. There is no change. There's no way for us to make a difference here. I go in, and I wish the IHS people were still here, because those are the ones we really need to be asking certain questions on. And I know that there's a lot of fear around this. And I'll do what the people want to do. But I do think that inciting fear in people on the fact that, oh, the government or the tribe can't run that, they can't run a business, they can't do this, they can't do that. I watched the Tribe 638, dozens of programs. When we went through the budgets, I seen the list of programs that we 638 contract, and we manage them pretty well for what little bit of funding we get. And on top of that, that little bit of funding we get, we have those people writing grants and doing extra things to bring in more money to better that program, because there's vested interest. It's not a bureaucrat getting paid whatever GS scale, whatever steps salary that they have to just run a program, and they're going to come in and get paid no matter what. You have invested people working for the people. And I have questions too. I have a lot of questions. You know, who's going to run the hospital? How are we going to select that? People are concerned about the tribe having a voice. Am I going to be able to call and say, hey, my auntie didn't get flown out today and you need to fly her out? You know, is the tribe going to be able to interfere and, you know, maybe prevent Ray's aunt from getting care because I'm loud and complaining about it? So, you know, people have the fear of that and the politics, and they've been comparing us to
oh, the casino, and there's just so much fear here. But for how long we have had IHS and how many deaths we've had and how many people have been denied services because they are stuck in the red tape that they have there. And I'm sure we have a lot of our own people up there. And I see them never getting promoted. One specifically, and she's a person that, I'm glad she's there to help our women. I'm glad she's there when I have to go up there. And she's constantly getting overlooked. And there's other people up there too, who I wish we could intervene and we had a say so, like, this is our own person. They need to be running this department. But we don't have that with IHS because the government controls it. And for me, it's scary. It's a scary thing because what happens if we fail? So can you answer that? What happens if we fail? What will we do? What are the steps that we take? Are we going to be stuck with it? Is the government going to just say, oh, you wanted this, here you go, bye? What's going to happen with that if we fail?
As a legal matter, you can retrocede the program back to the IHS.
IHS will come back in and take over.
Yeah, it'll be,
And
yeah.
it'll be just the same.
Yeah.
Okay. And currently, Mr. President, with the state of our hospital through the pandemic, we were made aware that the way our hospital is built, it's like Swiss cheese. I remember the contractors coming in and saying that. So if we contract and do this compacting, are we going to be able to get a new hospital?
There's two options for getting a new hospital. If you do a joint venture, it's allowed every 3 years. I think I'm talking right, Chris, is that right? And this is the year applications for joint venture. Through that, if you was to build a new hospital, they would have to staff that hospital for 5 years, right? $20 million, something like that.
Well,
But then we would have, if we built
20.
a hospital, the payback would have to come out of our third revenue billing. There's also another way we can approach a new hospital is 5 leasing. And that would be through the IHS, which there is no cap at this time for building hospitals. So it's kind of the choice of what the council wants. They want to go a joint venture. I think that's the best way to go myself, but it means that we probably would have to pay for our own hospital. If we go 105 leasing, we'd have the BIE,
Still pay for it.
not BIE, but the IHS paying for that hospital.
Thank you.
Yeah, just to clarify, we don't know when the joint venture construction program will reopen. And the way it works is that it's a several round process, so you'd be submitting something. You have good advocacy with your senators. They may have some influence on Indian Health Service. Our firm has worked with 4 different joint venture projects over the year. In fact, we're helping one that's seeking funding right now in a neighboring state. The beauty of that is you are underwriting the cost of the construction, but the Indian Health Service does come with what's called the new staffing package. So today there's maybe 300 staff there, and maybe there needs to be 500 staff, and so they would provide the resources for 85% of that new component. That's significant, and that's reoccurring dollars. I think the contract you enter into talks about, it's a 20-year deal, but there's joint ventures out there longer than 20 years, and the IHS is still paying that. The other would be the 105L lease. And again, that's you financing it, but not getting the staffing package. But then you're getting, you enter into an application process for the cost of your debt retirement, and Indian Health Service would pay you that. So, kind of do a needs a set.
Options for change, big change. And if we did that, would we be able to, like, if we do this compacting, one of the biggest problems we have here right now is our emergency room gets flooded, and it gets flooded with mental health patients or people needing detox. It's playing as a detox center, and there's always a lot of inmates in there too who need to get clearance before they could go to jail. So with that being said, you know, an urgent care needs to be a part of this package. And right now with IHS, I don't ever see that happening. And I sat in ER with my mom when she had a heart attack, and all the beds were full, and a lot of them weren't emergencies. They weren't actual emergencies. And some people on mental health watch and whatnot. So if we had an urgent care, I feel like some of these things, people could go in and get that help, and it would open up ER and save some of those ER dollars. And, you know, I said this yesterday, we're always talking about symptoms. We're always addressing symptoms, but we're never solving the actual problem. And those are the core problems. And I feel like getting an urgent care, and actually, if we're gonna have to continue flying out people, are we gonna be able to buy our own plane? Can we have our own flight service, our own flight team? Is that a possibility here? Because I'm trying to dream big. Can we partner with OHC and bring in some of their doctors? You know, can we partner with Avera or Monument? And what are the options? Because right now, all I'm hearing is the fears. What are the options? What are the possibilities? Is there possibilities to improve healthcare for our people here?
One of the groups that's a team is the patient services team, and that's led by Dr. Toby. And so he's aware over the last 10 years what's been the erosion of care at the facility. And that group is very committed to, you know, continuing the services, but then strategically adding services, make the recommendation of the board. We need to add this, 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 and this. You're bringing up urgent care. That's a standard of practice. It should be there. And so you're bringing up, you know, issues that this team is wrestling with. And both Dr. Toby and Dr. Warren are working on what are those issues. How do you restart some programs? I think you mentioned how many births are occurring. Well, all the births are occurring somewhere else now. Why? And looking at strategically, you know, can you recruit those people? That could be a longer term thing, but it should be the desire, the goal to get there at some point. Yeah. And you use the term red tape, and tribes, healthcare organizations, we have our own red tape, but it's a lot less red tape. And so, you know, entering into a contract, securing people can be much quicker decisions. Last week, I and another team member were on a reservation and doing interviews at an IHS facility. Oh my gosh, I don't know how IHS people can, well, they're committed, they have a passion for it, but to listen, how long does it take to onboard people? And then they talk about this whole thing, you know, we're talking about personnel policies and having position descriptions. To change a position description goes through a whole process of reclassification in the federal government that could take 6 to 8 to 9 to 12 months. You're not going to be burdened by these type of things. And then, you know, people going through security to use electronic health record. It's not going to take 6 months for someone to get approved to be in an exam room taking care of that patient. I mean, I just feel for those IHS facilities, and that, I mean, they're regulated by the red tape, and you know, as was addressed, the goal would be that you would see much improvement, but there is patience. It's a hospital system. It's not just an ambulatory care. And you know, having the structure of the board, you have 3 very strong primary stakeholders that represent that board: the health administration, the chair of your tribal health board itself and the president of the tribe. You know, they're going to be at these board meetings, and that's the voice of the future and the voice of setting the tone and where the services should be going.
Well, the last thing that I want to say is I think all of us really need to think about what sovereignty means to us. Does sovereignty, and think about the treaty. I mean, when you read the treaty, it says one physician for the whole Sioux Nation. That's what's granted in the treaty. Now, that switched and changed over the years, and it's mutated to an IHS facility for each individual tribe. So I kind of tread softly when we start talking about the treaties, because I don't want the argument to come back and say, here's your one physician for the whole Sioux Nation. That always scares me. But when we talk about sovereignty, so what does that mean? You know, for me, it may mean something different for me than it means to you leaders and the people that are here. But to me, sovereignty means that I don't need to depend on anybody else. That I have my own funding, my own laws, my own freedom to create and make change. To me, that's what sovereignty means. And with IHS, I just feel like there's no sovereignty there. And there's going to be a fine line holding them to their treaty obligation, which is the funding that they give. I would much rather take that funding and make the facility better. But that's just my opinion. And I'm not here trying to convince anybody. I'm just speaking my opinion and how I feel and what I see that we need to do. I watched a video, and you all could Google it on YouTube or look it up on YouTube, and it's talking about the state of healthcare here on the Rosebud Reservation. And it was in the 70s. My grandpa was on the video, my grandpa Andrew Blackwolf, and my grandpa Webster Tuhawk was on there as well. So it was kind of cool to see them sitting around a little table and talking about the tragic healthcare system that we have. And they're talking about the same issues that we talk about today, the same complaints. So I would like to try something new. And that's just, and let's hash out all our fears. Let's get out to the communities, find out what is scaring people, what they're worried about, what their concerns are, and let's get ahead of them. There's tons of questions about who's going to run it, and I think those are things that I don't know if we even have an answer to, but just being honest with people and getting the information out in any way that we can is going to really be a key to moving this forward, if it even moves forward. But I just thank you for your time.
We have, there's a few of them: Micah, Wayne, Tennille, Lila, Damien. So Micah, it's your turn. Go ahead.
Just out of consideration for all of us, we've been sitting here for 3.5 hours. Our guests, I think we need to get the blood flowing. And it's not to end the conversation, but
Can we break for lunch?
break for lunch.
And, continue after lunch?
Yes.
Is that what you're asking?
Yes.
Let's do that, okay? Let's take an hour lunch break.
Okay.
Sir,
Thank you, Micah.
lunch. We had Wayne. Wayne, that's a mouthful. Go.
Well, I want to thank everybody, or somebody, who at least handed this up.
Can you stand up, please?
Who was it? I will.
Lila.
Lila? Thank you. I want to remind tribal members that they can go to ihs.gov, and in there is multiple publications of what it is to self-governance of IHS or their health care. It would be the same as there's even a website for police departments and how to take over other departments. The tribe should always strive to take over and run their departments, in my opinion, no matter how scary it is or not, because literally if we're not trying to better ourselves, then we're always asking permission to how to do something. And we have to strive to fix our own problems and not just deal with little fires, because those little fires, when we work with IHS, never get dealt with. Going back my first term, 14 to 17, we asked them to have women's clinic then. Still don't have a fully functioning women's clinic. It's periodically they end up having it. We have absolutely no same-day surgeries, but yet we have a surgery room. And it's literally, what aren't they trying to fix? And when they say they literally don't have any money to handle PRC, that is true. In that line item, it may get expended every year. But they do not move money from other line items to fund any other line items. Those requests usually are from the area office or higher. So on a yearly basis, we send back millions of dollars to IHS, and we literally get no response. We can't even get that information of what was not expended from which line items. So all it is, when that IHS director comes in, all we do is yell at them, and it makes for great soap opera. Yell at them and tell them where they're failing. I'll look into that. And nothing ever happens. It's sad, but it's true. To this date, we literally have had 17 CEOs at our IHS since 2015 when the baby hit the floor. We had literally no new doctors. We have actually lost number of doctors from when CMS came and did their evaluation. When CMS did their evaluation, we should have 25 doctors. We literally have 3 in the IHS system, and that is it. So if the tribe didn't take the initiative in around 2017, I believe, maybe even 18, if the tribe did not try to address that shortfall and write a grant for Boston docs to come in, and that is anywhere from 4 doctors to 8 over the years, what would be happening right now with 3 doctors? So the tribe is, in a way, been trying to help and supplement IHS. We never get any specialty care, cancer care, diabetes, heart conditions. They all get referred out. They all get referred out. Never did the IHS try to do subcontracting to bring in those specialty people to help our tribal members. So the tribe pays all this money every year, and it's not very much. It's only a token of $150 to $100, and then the communities even kick in that much to try to send tribal members to Sioux Falls or Rapid City. So the tribe, once again, is still trying to handle the shortfalls of the trust responsibility of IHS. But when do we actually say we're tired of putting Band-Aids on it? Let's try to actually implement it and do it how we want it done. Do we want a hospital fully staffed that looks like Monument Health? Does it look like Avera? Does it look like Sanford? What is that? Well, they're never going to give it to us. We won a lawsuit. Nothing's changed. We've lost doctors. We've lost numbers of nurses. So literally, we need to be in the driver's seat. Boston doctors, when people start talking about commitment, that Dr. Tovey, he literally has committed himself, even though he's not able to practice as a federal doctor or on the contract basis that they initially set up. So he's committed himself to write numerous grants, millions of dollars for the Rosebud Sioux tribe. He literally has helped fund our meth addiction treatment facility. He's helped get grants for alcohol treatment. He's helped get grants that we're just now getting ready to open our detox facility. He's even helped get a specific doctor to get here so we could actually get the detox up and running, which is going to be in a matter of weeks as soon as we find a couple more technicians for treatment. So literally, that is commitment from the outside that people have seen that Rosebud's being progressive. So we're going to help them be progressive. Never in history, not back then in my first term either, and the same guys were in power then, except for Dusty. But literally, we've never had senators be on our side before, ever. Thune, Rounds, and we have Congressman Dusty. They all have committed to make sure that we try to get what we need to make this thing work. That's never been done in history, before them or not. So literally, that's where all these things have been put into motion since 2015-16. And the health administrator then, and since the health administrator then actually brought forth these ideas, that's where the council, some of you or a lot of you are new, I guess, but get on the website, educate yourself, talk to the individuals. We're at a point where we have a firm that's going to help us manage it. Talk to them. Get the specific questions that you need that are not necessarily public information. And reach out and get educated. That's what we're here to do. These same scare tactics and same issues of self-determination are nothing new. I didn't know it till the other day. I didn't think of trying to find anybody, and here their name got thrown at me. One of the ladies that helped spearhead the initiative of self-determination on the police department, 1992, tribal council reps were getting threatened then, directors were getting threatened then, and the same thing's happening right now. And one gentleman who was a very outspoken individual, he said, "You elected me to make the best decisions for the Rosebud Sioux tribe. I will try something to say we tried it and fail versus ever saying we didn't have the guts to do it." So literally, those are the things that are always posed, and we're at a point where I'd rather say I tried something new to help our people than to never do anything about it. Because when we chew out those CEOs from IHS, nothing happens. Literally nothing. Now, my other questions to these individuals was because we haven't gotten through and they have one more slide, they said. And I was waiting for my questions as I was asking. I was asking him about what questions he had. But I want to have these reiterated in a better way so that they are more, like the outside people aren't searching for these questions over the course of 3.5, 4 hours now. Okay? So I'd like you gentlemen to answer these questions for me. How do we get doctors to Rosebud to live and work long-term? Do we have a recruitment plan to recruit doctors?
Definitely the recruitment plan established to identify the vacancies of those that would become the tribal hires or the organizational hires. And, you know, our footwork is starting now related to that, developing position descriptions. And we have a couple resumes of individuals with HR background to consider. And, you know, the timing of us putting these people in place to carry on this work, because we don't want to inadvertently place a burden on the tribe's HR department at this time. So these would be personnel, and then we'll start the recruitment process.
And that also has to do with time of assumption, right?
Correct. And, you know, we all need to know that the individuals at the Indian Health Service today will have up to like 30, 60 days before the assumption to identify to IHS if they want to do the IPA or stay. So we could be very close to assumption and then realize, oh, there's a couple more positions that we're going to have to be advertising for.
Okay. Is everybody at the hospital going to get fired?
No.
They get offered IPAs if they want, otherwise they can transfer, correct?
That's correct.
Are we losing our sovereignty? Are we acting on our sovereignty?
No, you're not. This is a sovereign act of the tribal council to pursue this option.
So we're enacting our sovereignty?
Yes, I would say
Correct.
so.
Fulfilling it.
Will the hospital be open when the president of the tribe calls admin leave? Will they be considered 24/7 program?
Yes. Inpatient and emergency room is offered 24/7.
The,
Yeah.
Okay.
the leave and admin policies for the hospital will be set by the board, and that will be reflective of what a hospital needs.
Yeah.
And is there flexibility to do subcontracting with other healthcare facilities if needed?
Correct.
Yes.
And that is part of assumption?
Just like the
Yes.
IHS, you can subcontract with another entity.
Okay. Thank you, I'll leave it there.
We have Lila next, and then Damon. Damon, did you have one for us, Bill?
The floor for
Hello,
Yeah, it's just for the TV. So we can-
what's that? Okay. Yeah, my name's Derwin Sharpfish, and I just want to make this quick. As far as IHS funding, you know, my opinion is that why is it that any type of violent crime that gets committed, why does IHS have to foot the bill? You know, the ones that are doing the crime, you know, why don't they get to pay for it, you know, restitution whenever they go to federal prison?
I can take that. There is a right of recovery for tribes when they operate a program under Section 206 of the Indian Healthcare Improvement Act. So if there's a tortfeasor or somebody else who's responsible, like somebody in a car accident or somebody causes something or, you know, injures them, you can go after that person to pay for the service.
Okay, because back in October 1st of 2022, I got assaulted and I had to stay in Rapid City for 3 days, and you know, it's just something that I wanted to address because people that I talk to, you know, they're on the same page too, and you know, that's all part of, you know, something that's important because of IHS, you know, with the limited funding and stuff, and you know, it's just people that need help, you know, a lot of times they get denied, you know, for aftercare, to travel to Rapid or Sioux Falls or wherever. You know, every time my mom gets asked, she asks for help, they always deny her, so she's fed up. So, you know, this is a big issue that, you know, needs to be addressed, and, you know, hopefully that, you know, the federal case that's pending, I believe that, you know, I'm gonna bring this up too. You know, so I might ask that federal judge, or whoever it is, to, you know, make it so, you know, IHS is not responsible for anybody else's wrongdoing. So, you know, I just want to bring that up to everybody, and, you know, thank you for giving me the floor.
IHS haso iwashte, lana washte kaga chinki, uyikcha, kokata. O lana hibna ha heche lana ila waton kaikta onaji. Na ha takomi le lakota anopta pike lana toshki woke washteste chin. Agila kaikta naji. O heo lana taku washteste uyikcha lana a upikte kon hena oyake lana pila pikte lo tokaka ke. O hechansa na tagni ea mok chanzeka na yopka. Ea tagni hechu tishnkha. Wapi lana kaga. Na taku khat ele option lana. IHS toshko kuapi. Tejuta na taku. Lana wanka. Oash ni taku epi. Lana oglaka vichasha oglaka lana wayukcha na hechi. Chataku kilana washte kaba chimpi. Okay. I wanted to elaborate that these two gentlemen just want to help to better the IHS, put it that way. We complain so much to IHS that healthcare, medication, lack of doctors, lack of nurses, a lack of help. There's no reason to chew these two guys out. They just want to help to fill the criteria places that are needed, and to understand that what you guys want as legislators, what you guys need for the people, and how you're going to help the people out there to better this medication, better the doctors. Sometimes we get bills. The tribal members get bills. I just wasn't able to pay for those bills. That's what you're here for. How you guys want to help. You guys are legislators. You guys are leaders of the whole 20 community. They shouldn't get chewed out. They're just here to help. Now let one council rep get out of hand, yeah. But you know, she was wrong. Because these guys are here just to help to legislate, how to legislate the purpose. They're giving you all the ideas so we can better this. Just like the council rep Mocrick says, let's make a change. We holler for change all the time. So how do we make it better? So I just want to share that with you, council reps. Thank you.
And we have Ben and Emily. What?
Sure. I guess for me, I'm open-minded. I guess first of all, welcome Ben from the Detroit community. I'm kind of open-minded only because I said I'm a team player. I was campaigning, strong voice. One of the biggest things that I was looking at was, change. Change is hard, especially here. But we got to make sure. I was telling a few people that were asking questions, and these questions have already been answered by going through your presentation. I didn't want to jump on you right away to say, hey, what's going on, but I'd rather wait for your presentation, so that way most of those questions have been answered, so I can go back to those people who are asking about these questions, and then that way I can tell them. And me, I'm all about making sure that I understand what's going on first before I go out there and let people know. So that was one of the toughest things I know when it came out about the compact, about contracting the IHS. There was a lot of confusion, and I was confused too. I said, "Geez, I didn't know about this. I don't know what was going on." It was really kind of, I guess, hard for me to kind of swallow, I suppose you'd say, because it's a change. It's a big change for not only our people but our tribe. Again, our next generation is going to be seeing this as we move forward. But again, I like that we want to be able to look at what we could do, what could we possibly help the tribe change in some way, I guess. But for me, it's all about making sure that the people out there have an understanding of what's going on so that they can make a decision on it. Again, it's like what we've been hearing here is that the past, it's always been there. I mean, especially the past couple of years here, we've said that, the council has been just, moving, they haven't been moving forward. A lot of things, a lot of kind of petty arguments, I guess you can say. But to me, it's like we need to move forward and straighten out those, I guess the past that we're on, I suppose, on it. But for the IHS, we have a lot of problems. We have a lot of issues there. But a lot of the employees that work there have seen a lot of issues going on there. So to me, I mean, I mentioned this before too, trying to reinvent the wheel again, are we going to make it better for the tribe, for the people, or are we going to, and I'm not afraid to do that, to go out there and say, we're going to make change. And if we fail, then we fail. Then we got to make sure that we have a backup plan, be able to, to recuperate that, I guess. So, but for me, those are the things that I look at. And again, just waiting for you guys to get done with your presentation so we can actually, and again, too, now I know more about what's happening, what's going on. I can better inform the public of what's happening in my community, and put it out there. And yes, I think that the health admin director should be out there doing a lot more stuff. And I understand, she's, faced with a lot of stuff that's coming in, a lot of issues that are happening. People are saying, we don't want it right now, we don't have this, and that's what we're getting bombarded with. But to get the education out there, to inform people, there's a lot of things that came here when I first got on council last month. In fact, I'm one of the new council reps. So last month, there was a lot of issues with TLE, the BIA, they're putting in more new stuff, but they weren't putting it out there to the public, so people don't know. And the ones who did know were already bombarding calls with them and say, hey, what about this, what about that? So I feel this is the same situation. This was kind of put out there right away, and then people were saying, well, they should have did this, they should have did that. Well, to me, I'm thinking we should already have a plan like that. As far as council, as far as our legislators, government, we should have something in place already. We have a radio station, we have social media. I mean, for me personally, I'm thinking, going out there, is it door stops, I think, door to door for each community, giving out these pamphlets to say this is what's going on, this is what's going to happen. It's easy to say, come and do this, but we forget that, we're in a distant area. To get to Mission, to get to Upper Cut Meat, to get to Corn Creek, it's the distance-wise, I guess. So for me, we do need to get out there and let people know about this. So to me, I would do that to my community in Two Strike, to let people know, make sure they're aware of it. But again, it's just the education. If they don't know about it, they're going to be afraid of it. So that's why I think if we give them a little bit more information about what's going on and how it's going to help out. So a lot of this information regarding the IHS, the hospital itself, a lot of employees were actually asking about that. Am I going to still retain my status? Am I still going to retire? A lot of that stuff. And I said, hey, I got to find out about this too, because I'm not sure. I don't know what's going on here either. So that was kind of my thing. This is something that you guys should be coming in to find out. So that's why, I waited for a while. Otherwise, I'd be up here too saying, hey, what about this? What about that? So to give you guys the opportunity to, present, what you guys have to present and everything. But I'm glad you're here. I'm glad you stuck out the rain and everything too. First rain we have here for a while, so maybe a sign. But thank you very much. Again, thank you, Mr. Chairman. That's all I had.
So I have quite a list here of questions, and so I know we have some slides left, so if anything feels like you may be able to address in the slide, I'm happy to wait on the answers for any of those ones. But I also just want to start by saying I totally get any frustration, and I understand, how our previous council or anybody has been working on this for years may feel that we're slowing this process down. But with that said, I think because I am new to this, I really am taking this serious. So I want to make sure that, kind of along the lines of Ben, that we are doing what we need to do to make sure that we're sharing that with our people, because the information that we get is not our information. We are holding that from our people actually right now instead of sharing that with our people. And so it's a privilege to have this. It's a privilege to sit in the seat. But somewhere along the line that ball was dropped. And so it's great to hear that there's plans to do PSAs and plans to do that, but it's way after the fact. And so one of the main questions that I'm getting is it too late? What options do we have if the people have an opportunity to learn and don't want this? Because I've been getting messages since last night that it was told at one of our communities that it is a done deal. It's already done. You're gonna have to deal with it. Now we're just gonna educate you. And so I'd first like clarification on that one. I guess that would be my first question. And then I don't know if you want me to ask all my questions or answer one at a time and go back. I don't know what's easier for you.
I guess our question, are we too far into the process to go back?
Yeah, that's the first question.
Yeah.
From the legal perspective, the charter was enacted and it calls for a vote of 2/3 of the council to undo the charter. So that's the legal, that's what the council previously enacted. But obviously the tribal council is the sovereign authority of the tribe, so it's subject to all of that.
Go back into the questions because like I said, I've been taking a list as they've been coming in. The first one has to do with, will employees of IHS still be considered under union employees?
Oh, is there any, I don't know. I mean,
And if so, the tribe have to renegotiate any of those union contracts, and if so, does that jeopardize our sovereignty at all?
I don't know the
that question, as a legal matter, tribes don't have to participate in unions because they have the sovereign authority to decide whether or not to do that. But we haven't gotten to that step yet in the planning process, so.
Next one. What level of funding are we asking for, and is that guaranteed in the future? Are we locked into that amount? And then I have some follow-up questions regarding that.
So the funding tables that we'll be reviewing as part of the pre-negotiations is what the Indian Health Service is utilizing at the service unit. As I shared earlier, we know that the headquarters is funding the emergency room under a special appropriation they've received, which will continue to come to the Rosebud. And so then you'd have the annual increases. So, that's where everybody advocates for improved funding. And so that trickles down to continue to increase. And then the third party.
Yeah. I'm sorry. No, I just wanted to make one point. So when you negotiate your first agreement, just like you have with your master health contracts now, you negotiate the amount, you have the shares available. If you take all of your shares, for example, all of your funding, that funding amount is then technically called a 106A amount. It's a guaranteed funding amount. It can't go backwards unless Congress appropriates less dollars for the Indian Health Service. So it has to be the same every year at least.
So to build on that, I'm having trouble in my own mind, and people are questioning, where in this process does the tribe have the time and the input to vision what our big dream is? Because what I don't want to happen is, we know there's issues. Everybody, we could sit here all day and talk about, for all month, all year, about all the issues that we know. So that's a moot point, right? We shouldn't have to consider that anymore. The thing I think we're having trouble with is, our people have so many questions that aren't answered, and we feel like it doesn't matter. We're just going to get bulldozed. So I think if we can provide the information back to the people, that will help us moving forward with this. So I guess another question for that would be, actually first I'm gonna make a statement, and I say it, I'm gonna sound like a broken record, but in my experience, I'm gonna give you an example of, I took a trip to Haida Gwaii, Haida Nation at the Canada, and the purpose there was to have a knowledge exchange, and we were trying to develop sustainable funding for our tribes, specifically for natural resources, and using conservation to sustainably fund our processes and our programs. So up there, it was beautiful. I could go on all day about the experience, but the point that I'm trying to make with that is, they had a vision, they had a plan, they had unifying documents that said, this is what it is to be Haida, this is what it is to be a Haida Nation, this is what it is to live in Haida Gwaii. And if you don't like it, then you don't live here. It didn't matter so much if you enrolled or not. There was kind of some issues, but even if the non-enrolled people lived Haida, that was an assumption. And so what I feel we're missing here is that we are missing that connection. We are missing the organization. We are missing the unification of our people of who is Rosebud, what is Rosebud. And if we don't have that first, then all we're doing is transferring from IHS to another group of people that isn't us. All we're doing is continuing to keep our people out. I heard something earlier that said they developed this board because they wanted to keep the politics out. All I see is they use politics to keep our people out. Where are people in any of this process? We have 2 people on that board. One of them is managing some of this, so they get to manage themselves. Anyway, I'm losing my point, I'm sorry. So that was the comment that I was trying to make. So the next question would be, where is our plan, this big picture plan? Because I think I heard Wayne or somebody talk about, it's time we implement these things, right? We all know they need to happen. But how do we implement something that doesn't exist? So do we have a plan?
Yeah, the plan would be coming together to identify target dates. There's nothing today that's firm as to when an assumption would occur, but in the future, as a date would come about, then you're always 3 to 6 months prior to that putting things together. And I appreciate your comments about what I perceive as understanding the needs of the community. It is a fiduciary responsibility of a board or this group that's the governance to periodically do a consumer or community needs assessment so that the community broadly is speaking into these are my needs, and that's something we would endorse or subscribe to the board that they do periodically so that they execute that plan. And if there's not we know if there's not a vision, things don't happen. Yeah. Mm-hmm.
And I feel like we don't have a vision and somebody else is creating that vision for us and what they think we need versus what we need. And so again, I heard some talks about a potential assessment from health admin, and so I would like to request that it get emailed to us. And I do have a comment or a question regarding if that followed the proper procedure for an IRB. And the reason why I'm questioning this is because when it was spoken about, I heard something about we changed the survey or we didn't ask a question, and there are strict standards to research and data collection and things like that. And so I just want to make sure not only the data sovereignty piece, but also the actual data collection and research standards were followed with that. Were they? Did it go through IRB? No.
When the IRB was developed, it was health board at the time to see that members on board for the IRB, so it was passed. So we submitted through our answering committee at that time, and that's when we made the decision.
Okay, because we do have 2 actual IRB options, and one's through Synthetic Lesha and one's through the tribe, and so there was available.
So when this got brought up and we came on board, that was one of the questions that I asked, was if it followed the IRB process. But because the IRB for the tribe has never been completed, that process isn't followed for any research or anything like that, because
Sometimes it is. I had to look for it about a month ago, so I know sometimes.
yeah, so it's like not official IRB, but it's a process that we follow, but sometimes it is followed, sometimes it isn't, so that's also a concern too, so.
So I think again, regarding that, I think you mentioned some of it, but kind of goes back to the data sharing. I'm under the understanding that money was spent on these meetings, that money was spent for travel for our leadership to go and retain and gain knowledge about this process, and that was not shared with our people. So to hear things like, you need to get out and educate yourself is kind of disrespectful, because council was allowed the privilege to be educated. They were allowed funding and several meetings and resources to gain this knowledge. And I get that it's needed to have these decisions, but to not relay that back to our people prior to decision is disrespect. Okay, next question here. Sorry, I thought I had these better lined up. I think it's just a comment, and again, it's going to go back to having a plan in place. I heard something that was a little concerning regarding low-hanging fruit. And in my experience, working with the dominant society, is that's the go-to, what's easiest to do. And in our lives, in our reality, nothing is easy to do. There's very little low-hanging fruit. And the work that needs to be done is not that low-hanging fruit. So to hear that that's what we're making our priority is very disheartening. And so I would like to make sure that we do have a plan, that we do have a vision, that we do have implement assessments from our community so that we know what the needs are. How are we gonna sit here better than everyone saying we can fix everything when we do not even know what those needs are because we haven't asked? Sorry, I'm trying to find a question so I don't just keep talking up here, but I guess that my last thing would just be, how are we gonna ensure that our people are educated on this process, and how do we ensure that we know that the processes are being followed? And I guess the final thing has to do with the recruitment thing, because I was told at the last meeting that we're having trouble filling the tribal programs that are under health administration, and that we have had years to fill those and cannot. And so why are we allowing some program that cannot do that to do something when there's what, 100 to 200 positions versus less than that? So I really would like to see a plan. And I lied, this is my final comment. At that meeting in Rapid, it was also brought up that even though the tribe made the designation that we want to move forward with compacting, that is actually a decision that would lie within IHS, dependent on our audits. And in my interpretation, we do not have clean audits. And in the interpretation that I was told of this is we had to have 3 years of clean audits. And so again, why are we rushing through these things when really, if that's the truth, then why don't we take that time and educate our people and get the policies, get that informed, recruit, do that, so that by the time we do have a clean audit and that we can move forward, all those pieces are in place and we're not retroactively crisis management trying to throw things together. Thank you.
Thanks, Emily. Got Lila?
Thank you, Mr. Chairman. Thank you for your patience. I want to thank Emily for her comments and her points that she brought out. When we brought this on, and it was being discussed during my previous term, we had all these issues with IHS, and I explained when we were in Rapid, we had the big guns here. They all came down HHS. Nothing to this day has changed up there. And, you know, there's a trust issue with our people. You know, I don't know why we do things backwards. The hospital can be built. And this is what I was envisioning back then. We should have the government build us a new hospital. That's their obligation. Secondly, work on these tribal shares first to increase that. And that we are guaranteed that funding. Have them do their work. Have them bring these doctors in, you know. That's the kind of work I didn't see us try either. We should have hired probably you guys back then to do some of this for us. You know, you guys know what you're doing. You know, I witnessed it, I was there. I was thrown into it, but I really got a lot of information from you when I went to the meetings. I was real appreciative of that. But you know, we here, each and every one of us have a responsibility to our people. I'm a broken record. These guys are just here to present, you know, something and help with that process, but the rest of us. How many here, can I get a show of hands, have taken this issue to their community and have a motion declared, whether they want it or not? Has anybody gotten to that point yet? 2, 3, 4. Okay. Have you, Wayne? Okay, 5, so there's what, 5, 6? Anybody else? 7? Okay.
Just to clarify, not, I myself didn't get the motion part, but
Okay.
sharing the information.
Yeah, sharing that, okay. Because I got some text and they're saying in Oak Creek that it's a done deal. And I'm like, okay, and then some other communities, they're just now grasping, this is the whole hospital. And I'm like, okay, and they said, please don't shut the door on us again because we haven't been heard for the last 2 years. And these are things that, I'm just relaying for people. The other thing is that, as Emily said, we need that vision. IHS is gonna stay the same. They're gonna always do what they're gonna do. But right now, it's helping us. They saved my life twice. I would have probably been dead if they didn't have a surgery here. I had to have emergency surgery and they saved me. And we had a surgical unit here. We had babies born and everything. We had it all here. And it worked. I seen it work. And what happened? Did we do something at this level or did they do something? Something happened there. Somebody dropped the ball and here we all are. But I'm 53. I'm what'd you say, middle high risk person because I'm on all these meds. I have fibromyalgia, I have diabetes, you name it, I have it. But I'm looking at 20 years. Some of us here, age-wise. And then I look at the others who are gonna retire and what does that leave them? So it's not always about, everybody's on their own. We take care of ourselves individually. With all my problems, and I go to him and talk, get me in there. I'm not gonna stand here and tell him all my symptoms and whatever, because he don't know. But it seems like that's what's happening, because I'm getting people who have had transplants, organ transplants. They're scared. I have people who are long haulers from COVID. And ARPA did buy lots of machines, they did some of that work too, but we have long haulers from that. And when it comes to our health, who has the right? Who has the right to make that decision for each one of us? It is a human right. And we're trying to collaborate, and I'm really glad that we're trying to do that. And we're giving our people an opportunity, an option. You know what? We don't get options. They just hammer us with this, and we have to do it. But today we are given options. And I think we owe it to our membership. They put us here. When we're done here, we're going to go right back amongst our people. And we owe that to them, to send us to them. I don't feel I have the right to make that decision today for a transplant patient. I'm not God. I'm not the creator. But what I feel like I can do for our people is to give them these options. Let them decide. Because we are now in that age where before everything was IHS, but now people have been buying insurance, and we're on that track. Our treasurer worked with us, and we have our employees. We're doing everything we can to help kind of get away from that and also help with our bills. But, you know, in reality, you know, I'm really saddened when so many people are saying that they didn't know. I didn't know until August. Wait, no, when did we come in? September. So like the latter part of August. And I was like, wow, gee, yeah, that was coming up. And then pretty soon, you know, I'm back in and here we are. So, you know, we are giving our people an option. And I think that that's really good of this body. And it's good that they have those options available. You know, do you want A or do you want B? That's fair. I think that's fair to give them a voice, give them that right, because it is their life. It's their livelihood and it's their life. And as you get older, you know, our needs change. As we get older, you know, we bring people home, and we, you know, at our nursing home over there. Some of them, we have them here, and we have to have end-of-life care. What is that called now? Palliative care. Palliative care. So we provide that here at IHS, and families are able to be together. So we always, you know, we fight, but we make things work. And I believe that, you know, for myself, you know, I didn't get to take it to my community. I know that they, you know, the talk of it, they're saying they don't want it. So, you know, that's the other thing, is I have an obligation to my membership down there as well as everybody else. And until we follow those processes, we're gonna slip. And it's gonna affect what you guys are doing. Something could happen, like a huge lawsuit, you know, if we don't cover all our bases. And one of the other things was, you guys are all worried about IHS. All that, what about us? What about us as a Oyate, how we feel? And so those are just comments that I was getting. And I know that we're gonna probably ask for another meeting with you all. And after we have some discussion here with ourselves and everything. But, you know, options are good. We come a long way. We did come a long way, because before we never had options. And we also have to support our programs who are gonna be involved in this. That is the driver. And so we have to look at that. And right now, I know there's a lot on Skyla's plate. We have to kind of lessen that load somehow, and so, you know, we can create this if that's what the people want. So, you know, I did pass this stuff out, and it explains the difference, and that's just all people want, is they want information. So if we take this back, and, you know, maybe, I mean, I need to do that, and we come back here as council, and, you know, all of us throw it on the table. That's what I'm here for. And I said that, you know, when we're all together, that's when the thunder rolls, because I have that permission to speak for our people. And it is hard. It is really, really a hard decision. We are doing this collaboratively in council. You know, I really appreciate everybody, you know, taking this to heart, because our health care, you know, I'm sorry, you know, my colleague got upset, but, you know, it is an emotional topic, very emotional, very tough. And, you know, how we do things here is a reflection of 7 generations when we're not here. I'm obligated to the future. But when I say I want a hospital here, you know, and my vision was have them build us a hospital, have them bring all the doctors that we need, the podiatrist, the OB person, you know, all of them, the whole kit and caboodle. Handle it, then we go and work on the share issue, and that's gonna take like our 7 council fires. That's something we're all gonna have to work on. And then we step in. You know, our casino doesn't bring in a lot of revenue, you know, and that's a reality for me too, because we need that backup. We need that plan. And we are gonna have to, you know, we're gonna discuss it here and everything, but you know, I'm really glad the public was able to talk and give their concerns. We're gonna keep getting these, and I'm glad, you know, we're sharing this information, but it's still, there's still a lot of questions. So, just looking at that, you know, I think for myself, I wanna see this taken back to our communities and brought it back here. And maybe some of you already did, and that's good, but I don't think, I mean, I haven't done it yet, so I need to do that. But, you know, as, you know, Emily said, without that vision, where are we going? We all know what we want, and we want a good thing. We want good health care. We want good doctors. We want everything top notch. And we live in such a rural area, you know, and I was like, wow. One comment was, can you guys fly in those doctors from Sioux Falls to here? You know, what's the cost for that? Our people have to drive all the way over there for checkups on their heart. You know, there's a cost to that. What's that gonna cost us? And bring the services here. Is that a reality? You see that? Maybe we can do that?
With telemedicine.
Yeah, telemedicine.
The providers in their office, patients here, with a nurse, connecting. People's lives, and contract with a provider that could do that. There is Sioux Falls Elevate, they're involved with the ambulance service. Today, where you have an ER doctor on the call with the ambulance crew, even transferring that person to Sioux Falls or Rapid City Monument. That continued continuity of care with the nurse and doctor on the side. There's opportunities to explore.
And that's another concern, is our ambulance service. We really need to keep that up, and we need to make sure they do have their funding, because we rely on them. So, you know, those are some more concerns, some more things to think about, and I just want to make sure this was all presented to our community. And I think now people know, you know, that we're here to listen to them. But I owe my people that. I owe them that. And that's where my stance is. Thank you.
Thank you, Myra. Wayne Boyd.
From a different perspective, but before we do, to answer all these questions, the council needs to decide to go forward, because I think right now, we're out of money. You guys did a petition resolution, but yesterday you didn't ratify it, so you're gonna get up to date and talk about it. So I mean, if that's the first commitment you need to make, I think that we need to go forward to get these questions answered. But the people out there, they have a lot of questions that need to be answered, and we need to go forward, so that's one thing you gotta do, in my opinion. But the other thing I want to make some comments on, there's another side of this thing that most of you aren't aware of. And that's the fact that, number one, IHS itself does not feel they are capable of managing this hospital. they don't feel that they are capable of making improvements. They've told us that. Area office all the way to central office. That's why they're encouraging us so much to contract, because they know they are not capable of doing it themselves. The other thing is IHS as a whole has zero confidence on the Hill. When you talk to any congressmen or any senators, they have nothing but bad things to say about IHS. That's why they don't get funding increases. That's why they're always getting bashed. So that's the other side we have to think about and talk about here. I don't want to bring it up, but that's true. Every meeting we go to, we have to listen to that. It's embarrassing. But having said that, these people that were hired here to help us develop a plan, I have been very reluctant to get involved, because the last time we went through this, me and a lot of people put a lot of energy and resources into making this thing happen. It got to the point of coming to council when things were ready to go, and it got voted down. So all of that was for nothing. So this go around, I haven't been wanting to get involved. It took a lot of wind out of my sails. But I have to say this to these people that are helping us. That first board up there starts with negotiations. And when you start putting together these facts for us to go negotiate, you're already tying our hands, because you're putting everything together according to the existing IHS rules, the existing IHS shares, everything that's been a failure the last 40, 50 years. You're using those rules to put together a plan that we have to go negotiate with. Our hands are already tired when that plan begins. You need to do an assessment of what it takes to meet the needs of 38,000 individuals here in the middle of nowhere. Create that plan, and then start developing ways to fill it, budgets, whatever it takes. But develop that plan first. Don't develop another IHS plan. Don't listen to the needs of our people. We're counting on you to do this. And that's why there's so much confusion. That's why there's so much anxiety. There's not even a plan here, and you already talked to council into creating this corporation that's going to manage it. It's not even a plan. People are worried. So please go back to the drawing board and listen to what everybody's saying. We all want to do this. We all need to do this. But help us do it the right way. Listen to us. Thank you. But I'm telling you right now, we're out of money unless you guys re-up the thing, and I think you should, because there's a lot of questions that need to be answered.
Lila,
Can I get the floor for a tribal member? Thank you.
Good afternoon, Council. I took the time to be here, and I took leave to be here just to address this concerns. And, you know, the invitation was, you know, questions and answers. I know I'm not going to get the answers I need. But, you know, one of the things that was really important was that lawsuit that this tribal council won. This tribe won that lawsuit against IHS. Now, where did everything go? What plan was to be discussed after we won that lawsuit? I talked to the chair of the health board. I was told, yeah, we're going to set up these hearings. No, there was nothing done. That's been almost a year. You know, one of the things that really bothers me is that, do you guys understand health? It's really frightening to go into this compacting because, you know, a good example of mismanagement, everything else is with that police department. So yeah, I am afraid. We can't manage our police department, but yet we're trying to manage health care for our people. And now there's no plan in place to adequately address this. There's nothing in place to get these people on board to say, hey, we're going to come out to the communities and explain this. Our community has been in the dark for several years. We haven't had any kind of communication with what's going on with this tribe. And I guess, I came here a couple years ago. I was diagnosed with cancer. How many other of our tribal members are diagnosed with cancer? IHS is not a specialized clinic. They can't address the needs of what we need as cancer patients. How many people come out of there being diagnosed with stage 4? How many people come out of there being diagnosed as stage 2, the prevention period? So you see, it is scary, it is frightening, because that is one of the things that we need up there to address this health problem. There's a lot of our illnesses out there that are affecting our people, and we really need that specialty clinic. And the other thing too is that as a cancer patient, they fly us off, they send us to Sioux Falls, to Rapid City, to Minneapolis, down in Nebraska. Yet, we have to travel. We travel over there to get the medication that we need. And if you were a pump for extended cancer medication, these guys will not disconnect your pump. You have to go to winter. So there's another trip. What we need is a program, and I've discussed this with Health Administration. I even went to Health Board. They couldn't meet for 1 year. And then I start working with Skyla. Skyla has one of her grant writers working on trying to get a plan in place and to try and get some money to fund that. But what we need right now is a program that has a building that says Community Cancer Center. A lot of our people don't know what services are available. They go up there, they get diagnosed. Nobody tells them. My father and my relatives, my staff, I said, where do we go? I didn't know nothing. So how many people are affected by that? How many of your people are affected by these serious illnesses? We need that program that says Community Cancer Center, where they can go in there and they can get the assistance or the referrals that they need. There are certain supplies that they need. I know Sanford can't afford one anymore. And it costs $50 to start getting supplies. But it's really disheartening to know that cancer has been here for a long, long time. Other illnesses have been here for a long, long time. But yet, I don't blame these two people. I blame the chairman of the tribe, not specifically Scott, because several other people sat in that position. And I blame our tribal government. It takes a lot to educate yourself, to understand. When you sit on this health board, understand what you're in there for. You hear all these complaints. You hear the problems that go on at IHS. But where is the planning? You rely on your programs, your tribal programs, to start addressing these. But some of your programs just kind of put it to the wayside. I'm kind of the persistent type. I want to see something done. I want to see something done for our cancer patients out there. How many have we buried this last month? Quite a few. And it is shocking when you hear someone that has cancer. Our numbers are 500 plus. But it is shocking. This illness could have been prevented. When you go up to IHS and you're sick, do they sit down with you and discuss your MRIs or, the scans that they do on you? No, they don't. Luckily, I had one doctor in the ER that did explain this to me, and he panicked. And I didn't take too much off that. And yes, when they sent me off to Sioux Falls, it did come back positive, stage 4. Now what about our other tribal people, our tribal members that go up there? Just recently, in fact last week, another one came back stage 4. Wow, you know, people want to live. People want their health to be taken care of. And you know what? What's really saddening is our children are being affected with leukemia. You know, where is the prevention? I asked one time, is it the water? Why don't we have an epidemiology study done here? In fact, I wanted to go up to the tribal chairman's health board meeting and say, hey, Rosebud, we need to wake up here. Check the environment. How much of this is affecting us? Is that in the plan too? Is that in here that say where, you know, how do we start this prevention process? So yeah, there's a lot of things around here, and it's common knowledge. Everybody knows. It's the water. Look at you guys. You're drinking bottled water. How many families out there can afford bottled water? How many of our children are being affected by that? You know, it's really sad when, you know, you see this stuff. But what about our people out there? You hear this stuff. You guys all know it. You guys came in here to make a change. And you know, I see very few of the old council people standing up, but I see a lot of our newer ones asking more questions. And we need answers. You know, the other thing is hospice care. I've heard this several administrations. We need hospice care. And yet, you know, when someone's at their last stages of life, they go to a hospital. Some of them cannot be admitted up there. And some of them are, with a little bit persistence from the administration. But why is that? You have people that come from Sanford just to check on patients out here. Now, where are we at that? Hospice care is really needed. Even navigators to go out and do home care. Check on them. The other thing, you know, they always say, it's a liability issue. No, it's not. Our people do not have a price. As long as we have someone out there checking on them. When I talked to Skyla, she had mentioned she had a couple of people that can get this started. And that's been over a month ago. Now I'm still waiting. Is that going to really happen? And it should. It should happen. We have those COVID trailers out there. Some of them are coming back to the tribe. Take a COVID trailer and open up that community cancer center. Put these 2 girls in there that can do that. But you know, we need to start now. You know, where are we going? Are we going to be all talk and no action again? I hope not. You got IHS up there. I can get on with my chart at Sanford. I can pull up all my information. I can pull up all my billing. I get all my messages from my doctor. But one of the things that really disturbs me is that when I have an outstanding bill, I'm over at IHS. And they tell me it's taken care of. But the process at IHS is slow. They need to, you know, kind of update their timeframes when they can get these bills paid. But there's things that you have to do too. You have to have a purchase order and all this stuff in place. But in my chart, they give us this medication from Sanford or wherever we go. But it's all generic. Why is that? Why do we have to settle for generic medication? You know, we're just as same as everybody else across the whole United States. You cut your finger, what color is it? I'm sure they're not different colors, they're only one color, red. And we should all be treated the same. You know, I guess it's really sad to, you know, when these flight teams come in. I thought this tribe had a care flight. They, I can't remember the name of Eagle or something like that. What happened to that? You get a bill, and it's $7,000 to fly you from Rosebud to Sanford. Now you're getting people, you get flight teams coming in from Pine Ridge and Cheyenne. Those two tribes picked that up, and they were serious about providing a service. Now, what happened to Rosebud? If, you know, when the administration changes or when council changes, does everything stop and then we start all over again? No, 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 no. What should be happening is that when those positions are staggered and they change, it should automatically function as normal. But everybody seems to forget. And that's where the services start diminishing. You know, that we should have the best hospital here with that lawsuit that we won, the tribe won. Put the demands on IHS instead of bringing other people in thinking we can contract or compact because we can't even take care of our police department. That's frightening. Those employees up there, you know, there's problems, but they can be corrected. Now, what does that mean? When the tribe gives administration because of one little snowflake, they're going to be gone too? You know, those IHS employees are up there 24/7. You know, I met friends, I got relatives that work up there, and I see them going to work every day, whether or not EPP is called, they get them in there. And that's their position. They have to be up there, no matter what. But here we are, we shut the whole tribe down because of one snowflake. But you know what? I'm not here to criticize you. This is only constructive criticism. But I do know that, you know, something needs to happen here. And you know, again, there was no plan. We did not know nothing about this. People had no input into this. People don't know that, you know, this was coming on. Maybe they have with certain council people, but where was our input? Where was the community's input? I know there has been talk. It's a done deal. Just like Emily said, it's a done deal. It's not, you know, you get enough outrage out there in the communities, they can come in and march on you and say, stop this. This is the people's government. This is not your individual government. So, you know, I think everybody, you know, agrees. You put the cart before the horse again. And that charter was approved, what, just about 6 months ago in May? The board was put in place. Well, you know, it's really discouraging because these issues, cancer, leukemia, dialysis, transplants, all those, what's going to happen? You know, get on IHS. You need the OB clinic up. You need surgeries up. You need better dental care up. Our children have to go to Rapid City to get dental care. Those things can be demanded by this tribal government if we had a strong voice and we had people, our council people were educated in what they're saying and what the demands are of this tribe. But yet, we're like this. Now our people are suffering, our people are frustrated. But you know, it's really difficult. The positions that you hold, are you going to be like that the rest of your term? But hey, you know, you were elected. Get your programs involved. Get up there and support them. These are the services that we need here. And this needs to be done by the federal government. And that is a treaty right to have that kind of health care. So yeah, do you know what a cancer patient goes through? Mental, physical, emotional. When these cancer patients are in remission, you know, that thing is always in the back of their mind. Is it coming back again? So we're not normal. What services can be out there to help them? Our nutrition. You know, the education is really important for no matter what illness that a person suffers. But you know, people are dying. And people are fighting to live. That's what they're doing. They're fighting to live. But yet, you know, here we are. We have to come back here because, again, like I said, please educate yourself.
understand it before you go to Washington, because, you know, the communication to the people is very important. You guys travel, but where are the reports? What information you get up in Washington or Great Plains Tribal Chairman, where does that information go to that's going to help? So, like I said, you know, these people come in to help us, but yet that blame lies with this government, and that blame lies with the tribal leaders that sit up there. You guys need to get your stuff together. These guys can't get a health board meeting? Get on the phone. Get over here. We need this meeting right now. If you can't attend these committee meetings, don't sit on them. Get one of your rovers in here to cover you. You know, those are really important to start that progress and get it going so that there could be an end product that's going to be positive to our people. But I commend these women for speaking up like this, because you know what? They're sure educating themselves. They're sure educating our people. And you know, I know a council person that has no interest in this stuff because, you know, look what happened with the Redco case. But anyway, that's for another time. But you know, you got to take an interest. You got to learn. You got to listen. This is not your government. This is the people's government. And we need to get back to that. So if I offended any of you guys, I apologize. But you know what? It needs to be said. Cancer, all these illnesses have been here for years. Now get something done that's going to properly address these, and even for our children. Prevention is, we need that for our children. Hospital, you get an MRI, have them discuss this with you. I was diagnosed with the records that I had was in 2019. That's when I got it. And then I was diagnosed with it in 2021. 2 years. So what about our people that are stage 4? Yeah. But anyway, I appreciate you giving me the time to express my concerns, but you know, we need something for our specialty clinic. Like I mentioned before to a couple of council. Again, we could be bigger than an Navajo Nation. But the thing is that they have a community cancer center there that addresses treatment, nutrition, everything, because their people do not want to go to Arizona to get their treatment because it was too far. So they got individuals involved and they developed that community cancer center. So now they get their treatments, they get their nutrition, they get everything right there. Why couldn't we do that here? We are the second largest tribe in this nation here, but yet we kind of, you know, take a back seat. We shouldn't be taking a back seat. The other thing is the cost. Did you guys look at the cost of how much it is to fly a patient out, to give a mileage to go Sioux Falls, Minnesota, Nebraska? Those expenses are adding up and adding up. And like I had mentioned before, when they go over there, hotel cost is going to be high. Some of them can't afford that. They travel at 5 o'clock in the morning. You know, you guys need to think about those things, how to drop the cost down. And it was brought up here about purchasing a rental place like McDonald's in these cities to help our people out. But nothing ever got done. So, you know, I sympathize with the health administrator. She's got so much things under her umbrella there. But this council needs to say, hey, you know what? How can we help you? How can we help you with specialty clinics and to properly address the health needs of our children and our children? They are our most valuable resources, but yet we're not paying attention to that. So even our elders, look at our elders that are in their final stages of life. And those ones that have this terminal illness, they're in their final stages of life. It needs to be addressed. And I appreciate every one of you taking the time to listen to me, but I know, it's gonna be one year, after year. Let's not do that. After all, we're all in here together as a people in a government to try and make things better. Thank you.
We have a few more back there on the floor.
Lila, you want to borrow their mic? Because that one died.
Well, good afternoon, Council. You know, I've learned a lot just sitting in here. It really was a lot, because versus what Antelope's meeting we had with Skyla on them, I mean, there's a lot of questions that were answered. And the biggest one is, I like what Cher asked, what happens if we fail? And I think a lot of the people, sometimes they don't understand these big words. They don't understand your slideshows. And I when I talked to Skyla at our meeting, and the other two guys that were with her, I let them know, maybe if you break it down a little bit for the people to understand, instead of these big words and everything, maybe they'll get on track. Because I see the good. I see the good of what our council is trying to do, what you two gentlemen, Skyla, our administration's trying to do. You're trying to get our people good health care. You're trying to make sure that they're taken care of. I see that. But it took me to sit in here to listen. It took me to sit in here for that one question to come up, and what Cher asked, what happens if we fail? And that right there already, it already changed, because you had an answer. There may not be a plan, but at least you gave the answer that there still is hope. Now, if we could do better communication with our people, with our tribal membership, break it down. What is negotiation? What does that mean? What's the difference between contract and compact? Because I got asked that by an elder, if I knew the difference, because he didn't know the difference. And there's not many of our people that have the same access as all of us do. They don't have that access to look it up, to research it. I had to. I sat there and I researched one night the 638 contract and compact. I researched it. So that way, when I got asked that question, I would be able to give them what I learned off of researching. Now, those are two big words. They mean different in other situations, but our people don't understand that. So maybe if we could break it down in this next Q&A and at least provide them with a simpler understanding of what you guys are trying to do, what you're trying to do for the people and bettering their health. Because a lot of times I hear the elders talking about our sovereignty, our treaties. Those are two big things that our ancestors fought for. And a lot of times we forget about that. We think I. But it's not. It's what our ancestors fought for, our sovereignty, our treaties. So I think if we sit down and we break it down for our people. Because now there's a question that was asked on social media about my thought about the tribe taking over. Now I could honestly say I could answer that different. Why? Because I sat here today. I got some information. I got a better understanding. Because before my answer was, we might as well look at our neighbors and tell them goodbye. That was my first response to them asking me that question. But now today, there's hope. Why? Because I see all of you sitting here, our administration, council, Skyla and them, These two gentlemen, I see them sitting there trying to give our people hope. And that's what we need. I hear a lot about us having trust issues and not trusting. I had a conversation with my mom on the way home earlier. You know, we're always gonna have that trust issues. Why? I heard Chair bring up the Dr. Tobin not being over here at IHS. A lot of patients like Valerie, maybe she got used to one doctor and all of a sudden that doctor is gone from IHS. She built that relationship with that doctor, but now they're no longer there. So now you're bringing in new people. You're gonna have to build that trust back up. But before you get the people's trust, you're gonna have to start right here. This is a good start to letting us people get up and speak to all of you, to speak to you two gentlemen. So I don't even know who you are, but it's good to have you sitting there so we could speak and ask these questions and tell you this is what we want. We want better understanding. We want it broken down more. So I just want to thank you guys for allowing our people to come in. It's really important. That way we all have that understanding. And I do hear the people's complaints, their concerns about the tribe taking over. I was scared. But now I know you guys have a backup plan. If you fail, it goes back to the way it was. And that's good. Instead of versus saying, oh, I don't know. We'll think of a plan later on down the road. But I also wanted to share with council I went to, and the rest of you, something to think about, because I went into one of my meetings and up on my meeting wall there was this saying, and it says, the question is not what is wrong and how do we fix it, but the question is what is possible and how do we create it. And that's something to think about, because we always hear all these problems and we're sitting here trying to look to see how we could fix it. Let's start creating it. Let's start going back with our people. And there was probably a misunderstanding between all these meetings about it's already set in stone. You know, that's what some of our council reps took back to the meeting. That's what some of the workers from IHS, you know, it was a misunderstanding between communication. When which we should have really heard it from maybe our administration. People that had more knowledge about it versus than what we heard a couple months ago. So again, I want to thank you all for taking your time, letting us come and speak, and I believe that we need better health care. And I just want to thank you guys and keep working hard for the people. I know you guys get torn down a lot, but keep working for the people. Keep giving them that information they're asking for, and you would get their trust. So thank you.
Good afternoon, council, gentlemen. I just wanted to say that I'm really worried. I feel that this government isn't your government, it's ours. And our Constitution, you need to read that every day. It isn't just a fairy tale, it isn't just something there. It's the law of the land. Your decisions, every decision you make is about the next 7 generations. So everything you do today, you have to have that foresight of what's going to happen in 7 generations from today, because your seats here are only 3 years. And there's no guarantee that you're going to be back in. So what I wanted to say was that I'm glad that Toja here got up and spoke for the people and articulated what she needed to. And also for Wayne for saying that. It saved me a lot of time. You need to have a plan based on the people, from the people. IHS isn't working. All of you here, I don't know of any of you that have a IHS administrative background or a medical background. I've never known of any of you to take healthcare classes or administrative classes. That's a big responsibility. And you have to understand a CFR. You have to understand a CMS. You have to understand all of that, because you know what? You don't get to guide that hospital. You don't get to guide the nursing home. It's the federal government and the state of South Dakota. They tell us how to do those things. And you can't build a hospital because you want to. You have to get permission. You can't even move offices around. There's a lot to learn. And so it's a big responsibility, and I'm here to say that I really want you to go back and have these forums at SGU or wherever, where people can all come. When housing does their annual thing, they advertise it, and then they do it at SGU, so there's room, and people make it there that want to be heard. The Oyate deserve that. That's in your constitution. You are supposed to give us 30 days notice before you make big decisions. I don't ever remember hearing anyone talk about this. I heard about ideas, but I didn't know we were in a compact or whatever. I didn't know there was resolutions passed. We weren't even allowed in this building for 2 years. So please take it back to the people. Back up. Take it back to the people, put it on referendum. And these folks here need to work from the people, not from IHS. Don't borrow from other people. You work from us. What we need here and how we can get better health care. We did have 638 of the police department. We had 638 of the ambulance service. And you know what? The budget never changed. Ambulance service is always needing money. So if you 638 that hospital, when they run out of money, does this body have a plan to support that? Nobody supports the ambulance service. They're always broke. They don't have enough. There's programs that Chinkishni give them money. So there's a lot of things you got to think about. I'm not saying don't do it. I'm just saying bring it back to the people and let us have a referendum vote. Educate us, tell us what we need, because none of us got to go to those workshops. We didn't get the privilege of sitting around this table. Apparently it was a done deal 3 years ago, from what I heard, little bits and pieces. But and then the other thing about the IRB, we don't even have an IRB. We haven't had an IRB for 10 years, maybe 15. I think I was the last one to go through it with the diversion program. All of the IRB members passed away, and they never replaced them. We don't have a civil rights board here on our reservation. We don't have any of those things. So you know what? Your constitution and your ethics, you're missing some pieces in there. There's important parts to the government that belong to the people. So if I'm not happy with what's going on here and I want to do an ethics on you guys, there's processes that are missing. So you're robbing me of my right as a tribal member. And I don't appreciate that. I wrote letters to people here about that. And I was told to get on a committee meeting. Well, it isn't my job. That's a legal document that's supposed to be kept in our secretary's office. And it's gone. So if I'm not happy with what's going on here and I want to do an ethics or some kind of process, it's gone. So please go back to the people. Back up. And I'm getting carried away, but I just really am emotional about this. You're just disrespectful to the people, all of you. You know, you all said something about talking for the people. Make it about that. Have respect enough to give us time. You should have 90-day, 60-day, 30-day open forums. Maybe you could have it in Mission, St. Francis, Millette County somewhere, so that our people can go And then you can say for sure, yeah, we gave you chances. That's all we're asking, to be part of this government. You're all young here. A lot of you haven't even lived through hardships like us older ones have. You know, when IHS went through that change, we lost some people. They died. They're gone. I had a family member that almost died. If I wasn't outspoken like I am for my family member, they probably wouldn't be here. So that's why I'm scared, because it happened to me. And a lot of people aren't scared because it never happened to you. That's, for some reason, that's why we are the way we are. We don't have that empathy. Unless it happens to us, that's the only time we care. But anyway, this is a real important thing. And I'm not trying to stop progress. I'm just saying, let us be part of this.
Hi. Good afternoon, Council. I worked for the tribe for 20 years. I worked in different parts of the programs for the tribe, so I welcome you that come today and appreciate what you're doing for us. And to address council, I really hope that this body and the new council reps read the laws, read those ordinances. Go find the plans for the tribes because they exist. I know because I've read all of them. And I do want to say that I almost died twice. Once was when I got COVID and I was in the hospital getting ready to be sent out. And that was a horrible experience. I do commend IHS for saving my life. And the other time that I almost died was I had an 8-pound tumor. Non-cancerous, but we didn't know it was non-cancerous until it was taken out. I did partner with the American Cancer Society, and we made a YouTube video for expanding Medicaid. You can see that on YouTube. So I've done a lot of great things in my life, and I've experienced loss as well. The reason why I left the tribe was because I lost my mom, my dad, my mom's sister 10 days after she died, my oldest brother and his daughter 10 days later. So I know what grief is about. And so I took some time off of work and sat back and thought about all of the things that I've done for this tribe, all of the documents I've read during the time that I've been with this tribe. And I've always looked for strategic planning. I've looked for those documents that tell us what goals we have, where we're going, so that we can all jump on one train and we can all go in one direction. I hope for those days. And I hope that that's what this body hopes for as well. What I came here to say today is that I was really upset when we went to our community. I'm from Oak Creek community, and I was really upset when I heard about the IHS stuff. And I had no idea they were having plans to compact. And I worked with 638. I know what the 638 contracts entail. I've read many CFRs, and I know what that's all about. So the compacting scared me because there was no, if we got monies to go out to the communities and do those focus groups, we should have done them. And, sorry to these gentlemen here who have to listen to us tribal members who come up here and are upset because that didn't happen. You're here because the people put you here. Don't ever forget that. So what we did in our community is we started a community assessment. And now I know what we're going to do. We're going to extrapolate the information that we need for our community. Because we live in a second county in the nation in poverty. We live in a food desert. And for us, it's either food or shelter. We were trying to figure out what's first. Would you rather be in a shelter or would you rather eat? Those are two things we talked about in our assessment, in our asset building assessment. So for my community, and Wayne is our community rep, That's what we're going to do moving forward. So I hope that our information is going to be able to help this tribe. Because that's what I'm going to do personally. I'm going to go door to door, and I'm not getting $70,000 or $80,000 or $100,000 to do that. I'm doing that because I care. Because I think after working here for 20 years and trying to address this body many, many times on some of these ordinances, it's not working. It doesn't work. We're in chaos because we don't know what the plan is at the end of the day. We don't know where we're going. So I really hope that you guys know where we're going for the sake of the people. Thank you. Bopila.
One more slide.
Okay, good. I was like, hopefully it didn't die.
Okay, you guys got the last slide to go. It's gonna be a 30-minute slide.
No. Could be a lot of questions. So looking at the process, the final thing you come along is, and I appreciate, the lady making the comment about contracting, compacting. She used the word takeover, assumption is another, or assuming and operating. That applies to whether you do it by contract or compact. So at the end of that process, then there is the signator period where, and the difference between these two is the Title V compact is with the headquarters, so it'd be the director of the Indian Health Service signs off on that, and under the Title I, it would be the area director would be signing off on that. And then there's the process of the payment process begins. And so a tribe can elect at any time throughout the year to assume an operation. It doesn't have to be tied to a physical year. It can be any day of those. And and then that payment process would begin based on, let's say it happened earlier this month, then you would be the whole fiscal year. Well, if it's sometime into the year, then it's going to be that prorated to the amount that the Indian Health Service has. Also, part of the findings that Russ Peterson, that wasn't able to be here, and Elliot, as we review the documents, it's where are the savings today that are still on the books related to the service unit, and those kind of come to you as a one-time dollar. So so that would be a carryover that would come to the tribe. Anything else we want to?
I think that's it.
And these payments start about, 15 days after the assumption period occurs.
Yeah, that's right. But we're not, this is obviously
way down the road.
Way down the road. We're still in the pre-negotiation planning process, which involves the plan.
Yeah, the plan, yeah.
And assessing the needs of the community.
complete?
Yes.
We have a lot of discussion today. I think we're all kind of getting tired now, so, but I just want to make the last comment before we end our discussion with Chris and Elliot, is that when Wayne and I went to some of these meetings, we talked about educating the public, and we just weren't that far yet. When we talked about going to the Senator Thun's office and having a plan for him to be able to help with our healthcare needs as far as based on our lawsuit. We were talking about that way back, and so I think we need to give them a task of making that plan based off our need and underfunding, and ask for whatever we need to make that happen. And then they can approve that and make legislation to approve that based on our but our lawsuit. So I think we need the direction that they need to go. I think that we need to do more educating. I think that we probably need to come back and have another meeting after this. And so I think we need to slow down a little bit. That's what I got from today, that we need to slow down and make sure that everybody knows exactly what's happening with our compacting and of the hospital. So I just want to make the last comments there.
Could I say something? Oh. Okay. Do you want to go first?
I was just gonna make one comment along what Scott was talking about. I mean, everybody is, the public is really concerned about, because when they talk about compacting, they think the tribe is going to manage that hospital. And we know it's not true, that you're going to help us through that process. But when we do little things like in these meetings where you were having our departments go to those meetings to develop the policies, that just led more into the people thinking the tribe's going to manage us. So it's creating all these problems. So that's why the chairman is really adamant. You have to go out there and talk to the people, let them know what's going on.
Go ahead, Sheriff.
Mr. Chairman, I have to leave. I told them to have a break. Joe goes, how can you tell? And they said it's boiling out of the ground.
No, I just wanted to make a few closing comments. I know that I already made some suggestions to our health admin director to, as a path going forward to make sure that we're getting this education out there. But I also, was talking to a person who formerly ran our health administration and talking about a plan, and I feel like, she didn't come up and make any comments today. I thought she would have, but, when we were in the pandemic and when we were going through a lot of things, I was constantly reaching out to her and bugging her. And I know she's a wife and a mother and stuff, and that comes first, but I think everyone's concerned about all of the entities that are under Skyla. And everybody is worried, I'm sorry, Director Fast Horse, everybody is worried about that. And how can, the comment has been made today, how can she manage this and handle this with everything that's under her? So I really think bringing in some help, such as Ms. Espinoza, who was our former health administrative director, who did push this initiative before in the past, would be beneficial to the tribe. And also she could be focused on something like this. So I know we can't just handpick people off the street and there's a process to it, but I do feel like we do need something like that. And there was some comments made here today that were really hard to hear because I'll be honest, I was offended to hear that I'm not a strong enough leader to get IHS to make the changes that need to be made. I hope all of you have the opportunity to try and talk to Governor Rounds or Senator Rounds. He is an immovable object. His mind is made up. All of our senators here are Republicans in this state in South Dakota. So when the last time I went up, I was
thankful that we got in the door and we were able to actually sit down and meet with him. But what he said to me was, I felt like I was offended, but I kept my cool. But he said, have you ever heard of a contract or a compact? And you could go in and like partner with an Avera. And in my head I was thinking, this has been the talk for 10 years. But I'm going to let him talk to me like he's teaching me something and educating me. So it goes back to kind of what Wayne was saying, our treasurer, Wayne, about how there's no hope when it comes to, on the Hill with IHS. They don't get extra funding. They just don't. And all of the Republicans that represent South Dakota, they have their minds made up about it as well. So, I try my best not to take things personal here. And sometimes I think, I'm getting karma because my Unchi Black Wolf used to come in here and chew this council out all the time. So, now I'm getting it. But I really know that there are a lot of strong voices here. And I just want to talk and encourage all of my colleagues that I know that we get run down a lot and people are hard on us, and especially when there's something that's scaring them. But I just want to encourage you today to get out to your communities and give them the information and give it to them in a neutral way. Let them know and make space and set up times. And we should even go a step further, because one of the things that a lot of the council got to do that most of us didn't do was they got to tour actual facilities and see where it happened and talk with people. Somebody mentioned Navajo Nation. They're self-governance. They're a self-governance tribe. So when we start talking about self-governance and we start looking at all these other tribes in these facilities, maybe we should start including some of our community members, especially like our community chairs, bringing them along, and not necessarily to try and sway them one way or another, but so they can see the experience and they can ask the questions that need to be asked, that they feel need to be asked. And maybe these slideshows that we have, maybe some of the trips that we went on, I didn't go on any of them, but we as the council went on to tour the facilities, should include some of those, how those facilities look and how they operate. Prior to being on tribal council, I was at Redco, and we went to Chickasaw Nation with Governor Anatubby, and we got to see their facility. And their pharmacy actually makes money, not by just providing the pharmaceutical medications to their own people, but to anybody in the area who wants to utilize that service. So see, those are alternate options for making more money for the hospital to function. And I just feel like after we all sat here and talked and people were able to express their concerns and get answers, I think all our people need that. And most of us have been advocating, and I know we were told by somebody else from your group that that's IHS's job to talk to the employees up there. But somebody needs to talk to them, because IHS isn't doing it, and they're scared. It's their livelihoods, it's their jobs, it's their kids. They're concerned about all of that. So not just out in the communities, but a special meeting with the employees where they could speak freely and be able to ask all the questions and get answers that they need. But I just wanted to share that. Thank you all. I know it's been a very long day.
Eric, did you want to comment? I mean, I want to commend the work groups too. They went to all these meetings, they did all their input. They're the experts at making this happen. So we've got one of the biggest programs that has a shortfall every year, and so this is very important to that he gets this resolved too. So I'll let him make some comments. Go ahead.
Thanks, Scott. I've been a big part of this since day one. I mean, I've gone with Skyla to many of these facilities we visited for the last 4 years. And just like Scott had said, I do have one of the biggest programs with the biggest deficit year after year. constantly. And that's what really pushed me to really get involved with this, because something needs to change. I mean, our 638 process that works currently now, that funds not just the ambulance program, but, you know, CHR, alcohol treatment, so on and so forth. I mean, even SDPI that funds diabetes prevention. We're all underfunded. We are hurting year after year. We try to innovate new things to try to better our programs, but we always run into that problem of, well, how do we innovate when we don't have the money to do it? And luckily, you know, we've strived in that area, and we've been able to improve our programs throughout the years. But, you know, getting back to going to these places, you know, it is. Some of these were dream places to see. You know, to go to see to some of these facilities and see what they're doing with their process, whether it's Title I, Title V, you know, to see how they're delivering healthcare out there. It's just tremendous, you know, to see, use an example of San Carlos Apache, you know, where they came from day one to where they're at now is just remarkable. And that's the kind of stuff that I would love to see for us. And growing up in this area, just like, you know, Skyla and many other people have said, you know, I am a user of the IHS facility my entire life. I always say I grew up in that facility. My mother was a nurse there for 42 years. I was a EMT straight out of high school. I grew up in and around Rosebud IHS my entire life. I have friends that are there. I have family members that are still working there. And I know their fears. I know their fears that, you know, that if the tribe takes us over, or whoever takes us over, that how's it going to be? What's my job going to look like? Am I still going to have a job? Do I want to even continue on with my job that I have here? And those are fears that need to be answered, and I understand that. But I know there's processes that have to go through to guarantee that they're protected also as a federal employee, because we don't want their rights also as a federal employee to be violated, because they have rights as well. They have things that they have to follow, and the last thing we want to do is to jeopardize what we're trying to do with, you know, the government, federal government coming back and saying, well, you spoke to our employees prior to negotiation. You know, we don't want to give them anything to use against us. And I know that's probably not what people want to hear, but, you know, there is a certain process that needs to be followed, and we have to adhere to that. You know, whether we like it or not, there's certain things that just have to be followed. But that being said, you know, I do hear what everybody said today. I watched the, you know, the council meeting yesterday at home, just to hear what was going on today. I watched it on and off today, just to hear the different people, what they had to say. You know, back in August, Skyla, Dan Prue, and myself were asked to go to the community meeting in Antelope, and we tried our best to answer their questions. Some of those questions we couldn't answer. There wasn't an answer that we could give. And I know that frustrated them, because they wanted answers. They wanted things to be better explained to them. But that being said, you know, Skyla, myself, Dan, you know, we're not experts in this. You know, like somebody said today, we aren't experts in running a hospital, and nor do any of us claim that we can. We know that there's people out there that are better suited for that, but we want to be a bridge to help that, to bring that to us. We know that we have plenty of our own tribal members that are doctors, that are nurses, that are professionals, lawyers. You know, we know that we have those people there. And I always take pride in the fact that Rosebud is the cornerstone for all of the Sioux Nation. I mean, people look to us to see what is Rosebud doing, and what are they doing that works, and what is it that they aren't doing that doesn't work. And we set that trend throughout the entire nation for that reason, because we are a large land-based tribe. You know, and it's really hard to compare to like the Navajo nations, the Cherokees, all the nations in Alaska. You know, they have their own separate problems. They have their own separate things that they have to tackle that we don't here, and it's vice versa. We have a lot of things that they don't face there. You know, one of our biggest things is the fact that we are in a remote area. It's hard to recruit people here. It is very hard to get people to come here, not because of we're on a reservation, but because we're in the middle of nowhere with no Walmart, no McDonald's. You know, it's hard to get that there. We have a huge housing problem that we can't even get houses for our own people here. How are we supposed to house these medical professionals? You know, our IHS barely has enough housing. So there's these things that are just adding up, but hopefully, you know, going forward, we can try to tackle these problems. It's not going to be fixed overnight. I can guarantee you that. You know, day one, if we were to assume operations of our healthcare facility, we're not going to fix everything in day one. It's going to take years to do. And I think that's what people have to understand, that it's not an easy solution, but it's not going to be any better if we continue to go along the way we are. And that being said, you know, our IHS employees are working. They're working hard to do what they can to deliver the healthcare that they can to our people. Their hands are tied sometimes. You know, there's a lot of them that are true caring individuals that really want to help our people, but their hands are tied. Sometimes they just can't do that. And I sympathize with them because I know that there's a lot of medical professionals that have been here that are just like, I'd love to help, but I can't. I can't stay here and watch the way that things are going, so they move on. And that's really disheartening because, you know, you look back 20, 30 years ago, the amount of doctors that we had living here that were part of our community, nurses, we don't have that today, and we don't. And that's just a true testament to how the federal government has failed us as a place. We just cannot keep our people. And then the biggest medical trend right now is just contracting. It's really hard to keep your own employees. Everybody wants to go be a contractor because the money's there. At the end of the day, it's who can pay me the most amount of money to do the same job. And that's what it is right now. And I'm just kind of trailing off. So thank you for giving me the opportunity to speak and say what I did today.
Hello, I'm JD Traversy. I just wanted to come put my 2 cents in. I was employee of IHS for many, many years. I had a bad experience with them. I ended up going in a lawsuit with them and I won. And IHS just treats their employees, I'm sorry, like shit. And they treat their patients worse. And I don't know why all these people on Facebook, and I hear people coming in here, they want to keep IHS and keep that same role going. Like, I know people that go to Oyate Health and they're happy with it, and they say they're in and out like they're supposed to be. And like here, you go in there for your appointment at 10 a.m., you're not out till 4 p.m. And it's insane for us to keep trying to do the same thing and keep going to IHS over and over and over again and get the same results over and over again. Why don't we as a people try something new? And like they say, if this don't work, go back to IHS, go back to our 10-hour waits and dying in there. And I have personal issues with IHS because I caught MRSA up there and I was put in the hospital for months and I almost died. And my grandma, she was in there and they almost killed her off because they had the wrong medication in her IV in her bag. And it's just a nightmare up there. And employees up there, they know what I'm talking about. And the people, they know, they all have these horror stories. And I don't know why there's such a big fight against this thing, because to me, I think it's gonna be a good thing if we just try it. Just try it. And I wanted to come in and just commend all you guys for your good work and everything, and you guys are all doing a good job, and you new people, you guys step up too and do a good job, and you guys were voted in by us to speak for us, so I trust every one of you guys in here to make the right decision for the people. And I hope it's I hope we do go along with this 638, and that's all I have to say. Thank you.
There's one right there. There's one right there.
I sat here all afternoon and you know, I listened to all the comments, and you know, there's a lot of things. I came as a tribal member. I didn't come as an employee, you know, but I try to pinpoint all the things that are important. You know, the complaints, they're all important. But, you know, like this lady said right here about the CBA, you know, there's a lot of, in that contract with that CBA, there's a lot of things in there that when you read it for federal employees, and if the tribe takes over, you know, are they going to be able to negotiate that CBA? You know, because everything's going to have to, all the issues are going to come to the tribe. You're not going to be able to go to the union. You're not going to be able to file that complaint. You know, and another thing that kind of piqued my mind here was when this gentleman talked about Rockville. Are they really going to fund the ER? Is that set in stone? You know, because if Rockville decides not to fund that ER, where is that money going to come from? Is it going to come from what IHS gets, the percentage that they get to fund that ER? Because, you know, I'll take a guess, it's probably like $14-15 million to fund that ER. You know, and all of that money, where's it going to come from? Where's it going to come from if Rockville decides not to fund it? And what if the percentage goes down? You know, I think last time I was talking to somebody, I think IHS was getting 43%. So, you know, it's really underfunded. And if you have to take that money out of there, that's even going to drop the funding more for that facility up there. You know, and when Sherry made a comment about, you know, employees up there, yeah, you know, I'll tell you what, you have to be part of the good old girl club up there in order to move up, or the good old boy club. That's how it works. That's how every place works. It's just like right here. You know, you got to be part of somebody's club in order to move. And, you know, and another comment that, you know, the treasurer made, you know, and he, you know, kind of took me to a different spot, you know, because he said, you know, we need to move forward. We need to move forward. We really need this because our tribe's broke. You know, that money that's going to come into there, you know, it's not going to help support all of these other 638 contracts. You know, because if you're going to keep that operating, you're going to need as much money as you can to operate up there. And that's, you know, no joke, because there's a lot of stuff up there. You know, I've been there. You know, I know, I hear, I listen to a lot of the employees. They come and tell me, because I was in a position to hear a lot of the comments from employees up there on what happens in there, how they get treated, who does this, who does that, how are we going to fix this, how are we going to fix that. You know, you can go and talk to somebody, but just like, you know, one comment was said, it goes through one ear and not the other. It doesn't, nobody listens. But, you know, the best comment that I've heard, you know, is that they're right, you know, because I came to the last meeting. I don't know if you guys was here when we had that first hearing, when there was nobody here. I think there was only a few of us in here. And, you know, and I got up and spoke because, you know, a lot of the comments are always going back to the people. And, you know, we can make a difference by making it better, no matter what, who runs it. Whatever we decide to do, compact, contract, let IHS run it, but we need to monitor it. We need to monitor what goes on up there. You know, hold people accountable for what's going on up there. Instead of sitting here listening to all the complaints about it, hold people accountable. That's the most important thing. And, you know, and the people, you know, and, you know, all this education, you know what? We can tell them everything that needs to be known about it. But it's going to be up to them to decide whether they want it or not. It's because, you know, it always goes back to what somebody said about trusting. You know, am I going to trust it? Am I going to trust the tribe? You know, they're stuck in the middle. You know, what should I do? What should I do? But somebody's going to come along and try to sway them to say, hey, you know what? This is the best option to do. But, you know, we've all had our differences up there, no matter what. But, you know, it's going back and trying to work and find a solution to those problems. You know, we're always going to get complaints. Even if the tribe does compact, we're still going to get complaints, no matter what. People are still going to come down here and complain. And it's always going to be the same. It's going to be over and over and over and over until we hold people accountable. And that's what, you know, a lot of the leaders here, you know, we have to start looking at things like that, you know, is accountability. You know, I used to hear that long time ago from the old council reps that used to sit in here. Accountability, that's what we need to do. We need to do this. But, you know, we're all back in that same situation, and we're all talking about that same situation again. You know, so, you know what? I sat here and listened, and you know what? It has me in between. Because I heard the good, and I heard the bad. So, you know, for me, you know, I have to, like, read more. You know, I like reading. But I have to read more on it. You know, is it really going to be the best interest for me? You know, because some people, like the other lady said, they might not understand it. Break it down that she talked about. You know, because some of our elderly people, you know, they're not going to understand. They're not. You know, so somebody has to go in there and really explain, you know, what's the pros and cons? How's it going to help them? How's it going to affect them? Is it going to make it better for them? You know, the kids, you know, they're going to say, well, whatever you guys think, you know. But it's going to affect them down the line. Because 10 years from now, they're going to say, you know what, I had a chance to make that decision. I should have learned more, you know. But the education part is the most important thing. That's what we need to do. We need to educate from the eldest to the youngest and in between, because that's what we forget about, the in between, the high school kids. So, you know, there was a lot of good things here, you know, and like I said, you know, it has me in between there, but I need to read more, you know, and I visit with a lot of people, and you know, and we talk about this. They come to my house, we talk about it, and what's the best thing, you know. Well, I don't know, I gotta go find out too. You know, whatever I find out, I'll pass on to you. And that's what we need to do. You know, go back and pass it on to all the other people. You know, because some people, you know, they're not listening to the radio, they're not watching TV. But that's the best thing that we can do, is communication. That's what we lack, is communication. You know, because I didn't hear about this thing the last meeting, the day before. Somebody called me and told me. I was like, didn't know. But that's what we really need to do. Communicate and educate. The two most important things. And you know, and I know the people, they'll probably decide to say, okay, well, you know what? Let's do that change. Let's try it. Let's try it. Let's let our tribe run it. Let's see what they can do. Because I know last time we talked about if there wasn't nobody to staff it, you guys already had staffing services in place, right? Because I know we talked about that too. Because they were all going to get a servants package to come here. All these doctors and nurses, if all the employees walked out, there was a big old package for them. So, you know, with the people that are already there, why don't they get a package? You know, because, you know, going under that agreement with the tribe, you know, some of them are afraid because they think that the pay scale is going to drop. They're not going to get these benefits no more. You know, there's a lot of things that up there that I listen to, that they come and tell me of what they're afraid of. That's why a lot of them are against it, because they're not being educated either. And some of them told me, oh yeah, well, you know what? They never come down and told us anything. And there's another deal for lack of communication, you know. So we need to get that out to them more than anything too. Because once they hear maybe, you know, the pros, they'll probably say, okay, well, you know what? I'm not going nowhere, you know, I'll stay here and work for the tribe. That's what I'll do, you know, because, you know, you hear people already getting ready to start transferring out to other different IHS facilities because they're already afraid they're going to lose their position here. You know, good people that been here a long time, those are the people we need to keep here. But when they already start talking about already getting ready to move on, then we're going to lose the best people that we already have. So, but, you know, I really like the discussion that you guys had here. You know, it's very informative, and I hope all the people out there, you know, really got something from this, you know, because like we said, you know, they need more education about it, you know, and that way, you know, the people will decide, you know, to their council reps, okay, you know what, yeah, we want it, or yeah, we don't want it. But I really appreciate Lila for letting me have this time here, and I really appreciate the council for letting me have this time to make these comments. And you know, it's gonna be going back to the people to decide, you know, and let's hope we make the best decision. Wopilataka.
Comments, and we need to move on. We have the nursing home here. We also asked them to be here today. I think they have a request that they're waiting for to address council for. So go ahead, Chris and Elliot, if you guys want to make some closing comments to what happened today, then we'll move on to the next one.
Well, once again, we appreciate the opportunity to come and share, and hopefully, as we hear, this has been very educational. It's brought up some ideas. I think there's a lot of questions that we need to develop the question and develop a response that would assist any of the council members in their communities to host meetings and things like that. Because I think there's kind of a trend of similar type of questions within communities, and there ought to be a consistent response to that. So that's all I.
Yeah. I just wanted to say thank you all very much for having me out here. It's certainly a pleasure hearing and listening to some of the concerns out in the communities and some of the opportunities that we have. I hope that we've been able to provide some good information, and that's what we're here for. So if you have any other follow-up questions or anything like that, please let us know. We're happy to assist you all in that regard. So thank you very much. It's been very nice getting to know all of you. Thank you.
And we'll get this slide presentation sent to the secretary.
Yeah, secretary, and then she'll send it out to you guys.
And then the blueberry will highlight some of what's happening.
I think it's okay, right, Chris?
What?
Give that slideshow and that information to the communities?
Certainly. Yeah. I mean, we know that there's some words and verbiage in it that's a little high level, but yeah.
Great, thank you, appreciate it.
You hung in there with us today, Rick.
Usually when you end a session like this,
He has to by motion.
Shake hands, so let's do that.
Yeah, you can rest it and go grab it.
Appreciate all the questions and concerns.
All use Charles.
It's not, I gotta take off here in a moment. Yeah. Oh, wait, we're fine. Okay. Oh, there was a briefcase right there. Oh, is that it? Oh, okay. Oh, the document. How are you doing?
Thanks for coming.
Hey, thank you so much. Council, you guys need a 1-minute break?
Yes,
Okay, we'll do that. Nursing home, Randy and Evie are here to patient and talk about some of the stuff that they need council to approve, so.
So I wanted to ask if it's okay with you guys, I have Linda by phone, she's trying to get on by the Zoom, and I have Ron Ross and Jared, they're the part of the management team, if that's okay with you guys, if they're on by computer.
Yeah, our Zoom's not working
I
right
know,
now,
so I have them on here, if that's okay. Because they're a partial part of what we're asking for, and they know a little bit more about the new facility. And then Linda knows more, she's our, Linda Hunani is our board chairperson.
Samantha, we're gonna have, our mics, are they gonna last long enough to? We only have like
Do you
maybe
guys
3
want us to
mics that are
sit,
working,
stand?
so.
This one looks like it died too. Okay.
This one should be good, I
That
just
one
turned
should
it
be
up,
good?
I turned it
Okay.
off, so. Now we'll just let it go.
So we have on the speakerphone, Linda Hunani and Ron Ross, is that, or?
Yeah.
If you don't mind, I'll. Always been really needed a new one. There are all kinds of nursing homes closing all around us. We got almost a full staff, beds up there. She's doing really good. They get the money. It's one of the very few nursing homes that is fully staffed. But they've been working a long time on getting new nursing homes. So they've been working with an architectural firm to do preliminary design work, and that was handed out to you guys. But in order to finish the complete design, they need about a little over $1 million in the budget that's attached there. So how they're proposing to do that is they want to ask the tribe to kick in $600,000. They will kick in $500,000, and then we talked to Shakopee. Shakopee is willing to give us a grant for $500,000, provided we pass the resolution. So that would get it all planned and designed, and they've been working with the bond to issue bonds to fund it as one option, and then they have a bank they've been talking to down in Shattern that's to possibly fund it as two options, and then the First Interstate Bank that's been coming to us, they want to take a look at it. So there's three options there for the permanent financing. But how it will get paid back is by negotiating with the Medicaid people in Pierre, part of their reimbursement per patient. How that works is that the Medicare would pay for the depreciation of the building, and then that would just be equal to the principal and interest. So they would just have to negotiate out the term of the depreciation. So they've done a lot of work, and so they're here to tell you how close they are to getting it done and to ask you for those two things.
Okay, we'll start out with we have a resolution attached to their, to the 600,000, for design, planning design. You want to start with that, Lisa?
Yeah, I can bring that out there.
Okay. Motion for
emergency legislation.
Yeah, I don't remember what we left off at.
331.
331. Need a second. Emily, question by Michelle. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Opposed?
0.
Not voting.
1.
Motion to approve 2023-331.
Wasn't,
332.
332? Okay. Good catch, Fremont.
Need a second? Emily, go ahead, Lisa.
I'll start at the fourth whereas. Whereas on March 11, 2021, the American Rescue Plan Act of 2021, ARPA, 42 USC subsection 802, has sequence and amendment to Title IV of the Social Security Act, adding section 603, the Coronavirus Local Recovery Fund, intended to provide support to state, local, and tribal governments in responding to the impact of COVID-19. And in their efforts to contain COVID-19 on their communities, residences, and businesses, the fiscal recovery funds build on and expand the support provided to these governments over the last year, including through the Coronavirus Relief Fund, CRF. And whereas the RST Treasurer has recommended the RST Tribal Council authorize and approve the amount of $600,000 to fund the planning of design of the White River Healthcare Facility for the care of the elderly, and therefore be it resolved that the Rosebud Sioux Tribal Council has hereby approved the recommendation of the RST Treasurer, has recommended the RST Tribal Council authorize and approve the amount of $600,000 to fund the planning and design of the White River Healthcare Facility for the care of the elderly. Be it also resolved that the President of the Rosebud Sioux Tribe or his authorized delegate is authorized and directed to execute any necessary documents on behalf of the Rosebud Sioux Tribe.
Any discussion? Go ahead.
Why hasn't this been brought through the ARPA committee? I mean, we talk about processes and everything else, but.
Yeah, that was my fault, okay? That was my fault.
Any more discussion? Any questions? Stand. All in favor?
1, 2, 3, 4, 5, 6, 7, 8. 8.
Opposed?
1. Not voting? I was voting, so that's in favor, Just voting?
Not voting.
1.
3, 4. Ray, you're not voting.
I voted for it, okay.
All right, motion carried.
And then the following resolution is to, request Shakopee for an amount of, 500,000 to assist in that funding. Wait, do you want to explain this?
Yeah, there's a gentleman that works for Shakopee that's been working with the nursing home for quite a while. I can't remember his name. Anyway, the town ran trans. So anyway, he's been working with Shakopee on getting their assistance in this. And then the last time that Scott and I were in Shakopee about 2 months ago, we met with the chairman. And he also reaffirmed that, yes, that they would be interested in participating with this project. All we needed was a resolution. So this resolution would be requesting a $500,000 grant from Shakopee for the planning and design of this facility.
It's on the back of the last resolution.
Okay, we need a motion to bring on as
Emergency legislation, please.
333. Need a second. Fremont, question by Lila. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11.
Opposed?
0.
Not voting.
1.
Motion to approve resolution number 2023-333.
Second by Fremont.
I'll start at the fifth, whereas the Rosebud Sioux Tribe, and strike out the language up to requests. Request a resolution to request a donation from the Shakopee Metawankaton Sioux community, SMSC, in the amount of $500,000 for partial financing in the planning and design of the new health care center for the elderly. And therefore be it resolved, the Rosebud Sioux Tribe accepts and approves a request for the donation from the Shakopee Metawankaton Sioux community, SMSC, in the amount of $500,000 for partial financing for the planning and design of the new White River Healthcare Center for the care of the elderly. And be it finally resolved, the Rosebud Sioux Tribal Council directs and authorizes the President of the Rosebud Sioux Tribe to sign and execute any and all documents related to the requesting a donation from the Shakopee Metawankaton Sioux community for the Rosebud Sioux Tribe.
Any discussion? Treasurer, is that the right word for donation, or that was
Donation.
Any questions? Discussion? Not, we need a question. 10. All in favor?
1, 2, 3, 4, 5, 6, 7, 8, 9.
You voting? No.
9.
Opposed?
In favor, sir. Yeah, me too.
You in favor? 11.
Opposed?
0.
Not voting.
1.
Motion carried. Read now? Was that it?
When we have a grand opening, we'll definitely do that.
Just some information that I wanted to share. So earlier in the year, so with all of the funding that's been coming down through like the DOE and USDA, there's been a lot of grant opportunities through partnership with Tahoe Tribe and Economic Development specifically that we've been looking at. And we wrote a paper and like a letter of interest, and we got back basically an offer, but it's for June Colonel, and brought it here to the council, but at that time the council didn't want that.
But I think that if we would revisit that, I think that would be something that could be beneficial to this project. I'll connect you with the right people and I'll make some phone calls and stuff and see if we can invite you to maybe have one development committee or have a separate meeting.
The geothermal is, the well is already there. It just hasn't ever been connected to the facility. So.
Sounds good.
Anything more? Any questions for Brandy or Evie? Not. Thank you guys for coming in. Sorry for making me wait all day long.
Thank you guys.
That's it?
Budget and finance tomorrow. Right there.
So you'll take care of me when I'm well.
Okay, all right.
I gotta go. My mama came with me today.
Oh, good.
Yeah. She had her eye injection yesterday, so she can see today.
We're gonna lose the quorum here, so, Wes leaving and, Lisa's leaving. So Monday we have, budgets, all dates for budgets to look them over and approve them. And we can get done soon enough, we'll get back on our agenda.
Bring your calculator.
I know.
Okay?
Lisa, did you get that resolution done for?
I'm gonna email all of you the budget by tomorrow, so it should be Monday next weekend. And then on Monday we'll get into.
Oh. Yeah, we'll do it Monday.
It'll be okay?
Yeah.
All right. The one that was missing the page, that's the one I was thinking about.
He emailed it.
Oh, okay.
You guys need to get that printed off. Oh, for Eric Emery? Yeah. He emailed that to me. That contract.
Like on the second day of our meeting on next month's meeting. November, so it'll be on that Thursday.
I gotta go pick up meds.
We done?
5:30.
I don't know if he officially. He's like, well, I'm breaking harmony. Okay, thank you.
So you'll take care of me when I'm well.
Okay, all right.
I gotta go. My mama came with me today.
Oh, good.
Yeah. She had her eye injection yesterday, so she can see today.